We'll call this meeting to order of the Arkansas Livestock and Poultry Veterinary Medical Examining Committee. We'll start with a roll call. Dr. Plum, you want to start?
Here.
Kate Williams here.
Rob Connor here.
Sarah Klein here.
Sarah Throne here. I think the only member we have absent is Dr. Hewitt. We'll start with administrative items. We'll start with approval or any corrections or additions to the minutes. One correction that I had is it had members not present. It had several members from the commission, which should not be included as members not present. But Tyler Davis, Chad Chester, and Danny Wright should not be listed as not present. Any other corrections or additions to the minutes? Is there a
Motion.
motion
Adopt it, or the minutes is.
as amended? Is there a second?
Second.
So we have a motion from Dr. Porter and a second from Dr. Plum to approve the minutes as amended. All those in favor say aye.
Aye.
Opposed? Very good. Reviewing continued education hours. Candace, do you want to roll through those for us?
Can y'all pitch that Excel file up? And there, we struck a yellow line for everything since our last meeting, of the CE hours.
As the ones.
Oh, you only put those, awesome.
Perfect.
Give me a second, I'm gonna share, okay? Share the screen, so everybody else needs to see it, right? We have anybody in the outside world that needs to see it? Pass us it.
Speak now. Nope.
That one,
Okay.
Yes, sir.
okay.
Any questions on?
Can you
the-
magnify those a little? Sorry, sir.
No, you're fine. Everybody got those before. Did anyone have any questions of any of the continuing education that's been approved? Okay. I believe that's just a review and not an approval.
It's gonna be great on me.
Certified veterinary technicians, we have 5: Allison Blevins, Hannah Height, Jessica Price, Morgan Rosenbaum, and Callista Weaver. And these, my understanding is have reviewed dossiers and have approved those. Any questions for staff? And review of certified veterinary technician for reciprocity, Kelly Bloomfield. Any questions on that? Okay. Applications, we have a separate practice for the veterinary care of Dogwoods Trails PC. Any information on that one?
Where's that located?
Candace, can you share any information about that one?
This is one that came in this week and we've gotten their articles of incorporation. Thank you.
And, Darnell.
Darnell?
Is that on your desk, can you grab it?
That's fine.
Yeah.
Thank you.
Yeah, because historically we've seen that information. But if you check it off.
And at some point, we need to have a motion to accept all these by consent agreement.
Okay,
And we could go through all of the lists and do them all in one fell swoop.
on the veterinary technicians
Or we can do them, I think we can do them all as a consent. Or do
So,
we need to do each one.
These are, when you're saying reviewed certified vet techs, these are for continuing education hours, right? Just to approve the ones that they've submitted, right?
I think these are new,
These are
no,
new.
these are new CDTs that are getting licensed.
We've already accepted the continuing education hours. Now we're looking at people who have asked for a license and or have been granted license and have fulfilled all the stipulations that we checked
And
on.
that has been reviewed and it's
And none of them have
only
any
passable.
action.
It's
None of them have any actions.
Okay.
So we have a motion and a second
we-
to vote on the review of the continuing hours before we
Okay.
move on to.
okay, because last time we didn't do motions to approve those, so you want motions to approve on those?
Are we,
Whatever administrative rule says, we need,
I thought we had it as staff approve those.
they are administrative approvals, but we're pushing to you and then you guys are approving it. And then again, we push it to the commissioners and they would need to approve it.
Okay, so you need a motion,
So,
we need a motion on this, okay,
no, we're not on continuing education.
Okay, so-
We're on.
But we
Whoa,
never,
whoa, whoa.
we never did make a motion on that.
yeah, we
Yeah.
need to go back up top then, if that's what
Yes.
Tanner's telling me.
Okay.
So we'll go back up to, reviewing continued education hours, can I get a motion to approve those?
I make a motion to approve the continuing education hours presented.
We have
I'll
a motion-
second it.
Motion and a second from Dr. Plum and Dr. Klein, all those in favor?
Aye.
All those opposed?
Can I amend the location of the corporation? It is in Bentonville.
where we have got?
Yes.
I'm sorry.
Give me just a minute and we'll get to that.
Jumping around.
Sorry.
So we need a motion on the approval for the certified veterinary technicians, the 5 of them, Alice Blevins, Hannah Height, Jessica Price, Morgan Rosenbaum, and Callista Weaver.
I just want to verify, these have been vetted, they've been,
Yes.
yes, all that.
And that's, Kansas is doing that great,
Yeah,
because she goes down the
okay.
checklist and has everything and doesn't move anybody forward.
Until they met all the criteria.
And any questions that you have, then those come before us.
Yes.
Okay.
And there may be that one point, Kelly is the one,
Yes.
we may need to give them more details, so you'll know about Kelly. I think there's a little backstory on that one, but these have all been gone through and the reason why Kelly is out there, there's an exception. I think you might need to be informed of what we did there, but
Okay.
but all of these have been processed by the application, and that's our administrative function there, is that we can give them a temporary license while we're working on it. And then once we get that, then we can issue them a license, and then we say, hey, we issued a license to this person, you okay with that?
So do we have a motion to accept the reviewed certified veterinary technicians?
I move to approve the 5 names on our list for CVTs.
Is there a second?
I'll second it.
So we have a motion and a second from Dr. Williams and Dr. Klein to approve the 5 certified veterinary technicians. Is there any discussion? All those in favor? Any opposed? Okay, then we'll go back to the review of the certified veterinary technician for reciprocity. Can you please inform us on that case?
Madam Chairman, that's a different case. This one's straightforward by reciprocity.
Okay, so
Oh,
Kelly
okay.
Bloomfield is straightforward by reciprocity. Okay,
Yes,
I move that we approve, Kelly Bloomfield's, CVT process as well.
very good. Is there a second?
I'll second it.
Okay, we've got a motion and a second from Dr. Williams and Dr. Klein to approve, Kelly Bloomfield for CBT by reciprocity. Any discussion?
He works for me, do I need to recuse myself or no?
I don't believe so.
I don't believe so.
Okay.
Sounds like
It's not
straightforward.
That's fine, and make
it's not a rule of action.
Okay.
And
Additional discussion? All those in favor?
Aye.
Any opposed? Motion passes. Okay, now we'll go on to reviewing of the corporate practice. So veterinary care dogwood trails of apparently Bentonville. So can we get details on this one?
You may talk to you what?
Okay. So this application came in this week. And it does have the articles of incorporation with it. They are in Bentonville. And this is, owned by Dr. Audra Marie O'Keefe.
There's a corporate.
It is a corporate practice.
Owned by a bigger,
I'm sorry. Owned by
owned
me.
by a bigger corporation. For which one?
I was, curious.
Just out of
which one.
curiosity, can you share that with us?
I'm not sure if there's anywhere in there.
I don't know that it does.
it should be in their articles of incorporation, who the parent company is.
I'm not an address.
It's in New York.
Pardon?
I just narrow it down too much.
Vet partners.
Said vet partners out in New York?
Yes.
Thank you.
Do we need to make a motion to accept it as is, or?
And then if you guys want additional details.
Mine was more of a curiosity than an actual question.
Yeah, I think I'm good.
Is there a motion on the floor?
I'll make a motion to accept the corporate practice.
Is there a second?
Second.
So we have a motion and a second from Dr. Plum and Dr. Williams to accept the packet for veterinary care of Dogwood Trails PT in Bentonville. Any other discussion? All those in favor? Any opposed? Motion passes. Now we have applications for reciprocity. These are all veterinary applications.
Dr. Klein, our legal counsel has said that the names don't have to be read. We can just go
Okay.
with the veterinarians through reciprocity.
Very
And
good.
we can do that on the next list as well.
Okay, very good. That will save me butchering names. These have all been fully vetted, double checked credentials, met all the requirements.
Yes, ma'am.
All I's dotted, T's are crossed.
No license issues, no license issues.
And this is a larger list than we normally see,
That's the new
Yeah.
graduates, huh?
Just, yeah,
and along with the new grads, but
Yeah, there are a lot of reciprocity.
Yes.
And these reciprocities were held over from things in the past.
previous,
They've been hanging on the office for a while, we've just been trying to collect all their stuff.
so it's an unusually long list because you're catching up
Yes.
There were a lot of issues hanging
When we
there.
got Candace, she was able to
God.
get all that stuff real fast.
Like
Good job.
Mhm. And some of us got distracted by licensing processes.
is there a motion on the floor to accept the veterinarians by reciprocity for licensure? I'll make that motion. Is there a second?
A second,
All those in any discussion? All those in favor, say aye. Aye. Any opposed? Okay, now we move on to our list of new applications for licensure by veterinarians. And all these have been dotted i's, t's crossed.
Yes, ma'am. These are the applicants that just passed their exam this week.
Okay.
Exciting.
so they currently have temp licenses, they've taken their board, waiting for the Arkansas Livestock and Poultry to do the final blessing, and then they'll get their state
That is
licenses.
correct.
Yes.
And a lot of these are new grads.
Yes, and FYI, we're looking at enhancing the license.
What does that mean?
A
That test,
little bit larger, more fancy.
Oh, just.
There's a-
Oh.
Certificate.
You're gonna make it prettier.
Certificate,
Make
yes.
it look better.
Yeah,
Right.
and that test was administered just recently, correct?
today was the last day.
That's online, so.
Today
Online,
was the last day.
okay, so still all online.
Well, I'll motion to approve the veterinarians, that I guess are applying for new licensure.
Is there a second?
I'll second.
We have a motion and a second from Dr. Klein and Dr. Williams to approve the list of veterinarians requesting new licensure. Any discussion?
We welcome them to the state of Arkansas.
Yeah.
Welcome to work.
So seeing no additional discussion, is there a motion to approve? All those in favor? Aye. All those opposed? Welcome to the state of Arkansas.
Mhm.
Commission approval. Okay, now we move on to our dockets.
There we go.
So we'll go in the order that they are on the agenda. So we will start with docket 2023-06, the case of Kathy Cole, bringing against a complaint against Clifton Tech DBM. Somebody wants to give us the lowdown on this one, summarize it, please.
I'll take this one.
Dr. Williams?
All right, this in summary, this is a case going back from 2023, and this was a client that presented for a health certificate for a bird going to Mexico. And as you've read, there's a lot of information in here, a lot of dates and time. But my summary is this was a international health certificate process that was very time consuming. And they had their health certificate denied 4 times. And the complainant came out of the concern with the time and the process and information and communication. So my recommendation is the only thing that I really would have liked to see more of, just medical records and documentation from the veterinarian about the process and the communication with the client, because a lot of it was client communication. And it was the VEX system doing its job, and meanwhile, there was some testing that was completed that was not appropriate, and the more he dug into the process, there were more tests required.
And there were, at that time, shortages on Palorum and Gallinarum testing supplies, because we ran into that just for the poultry industry. So that was a legit concern that was happening at that point in time. But, there were a few things that, citizen versus, gallinaceous birds, of understanding those differences would have helped him follow the process. And understanding what test truly needed to be done versus what test didn't need to be done, but.
Yeah, and I think if you're gonna write international health certificates for people who have deadlines, you should know ahead of time what tests need to be done and have done that research. Just because of those kinds of paperwork mistakes are so easy to make.
It is, they are time consuming things, and clients often don't want to pay for the time it takes to do them and to do the research properly. But if you're gonna accept doing it, then.
Yeah.
You
that's
charge
part
for
of
it and
the,
you do it.
I think if there would have been more documentation about the knowledge, in a medical record, initiating the VEX system, got the information, that probably would have reduced a lot of the confusion early on.
So I'm wondering if we should request medical records from Doubletree, and even from Chanel could be very useful in this case.
Wouldn't that have normally been included with this request?
Yeah, I mean, the medical records are there.
the 3 had.
Right.
Well, we have lab
They did.
results.
They had lab results. They didn't have any actual records.
And again, I probably need to recuse myself from this one. Cliff Beck and I are partners in multiple businesses, so,
Yeah.
I will recuse myself from that.
Well, and I'll state, I worked at Chanel at the time. I was not the doctor on the case, but I was sitting next to the doctor on the case. So I don't know if I need to recuse myself because I wasn't actually involved, but I was like around.
Myself.
I'm partners with the defendant in
Okay.
several businesses, so.
In what sense?
We own veterinary clinics together.
Do you own this one?
No,
On record, have you heard anything about this particular case prior to? Are you cousins with him?
no,
Or, family, friends, how close friends, anything like that?
40 years.
Gosh.
And just let me recuse myself on
Like that, yeah.
Yeah.
Say, I don't know if you have to, but
it.
yeah, it's just your call,
Yeah.
on that, on,
I do have previous knowledge of this
yeah.
case.
And so, 2 recusals, a quorum is a majority of the voting members, so.
4, so we've lost quorum.
So
But if we request the records from these clinics, we can pick it up at next meeting.
we can. Now,
So that would give us both information and time.
Dr. Hewitt in and make it easier.
We'll fly them in from Canada.
So can I move to table this and request full medical records and bring this back to the next meeting?
We have
Until we have quorum.
We have a motion on the table to table this until the next meeting when we have quorum and request additional medical records. Is there a second to that motion?
I'll second that motion.
Any additional discussion? All those in favor say aye. Aye. Any opposed? Okay, we will table this one for further discussion and request additional medical records. The next item on the docket is, or the next item on the agenda is docket 2024-01. This one is, the complainant is Thomas Hickox against Claire Kelly. Would someone like to give us a summary of this case?
I can summarize it. Yeah, so like you said, Thomas Hickok versus Claire Kelly. Thomas brought in a 7-month-old German Shepherd dog, who was a bilateral cryptorchid, so neither testicle had dropped. The intention was to do surgery to find and remove those testicles. The dog was sedated in the room. There is some contest about what sedation protocol was used, but was sedated in the morning in front of the owner, and the surgery was performed later. The dog passed away during recovery. It sounds sudden. The veterinarian offered for necropsy services to be performed on her own payment. The owner declined, but it looks like did pursue necropsy services. And then the complainant is concerned about negligence.
One thing that came up with me is the veterinarian that called and wound up having the necropsy done was this woman's original veterinarian who had diagnosed the cryptorchidism.
Right.
Why did she go to this other vet for the surgery to begin with? And is there any animosity between those vets? The liver laceration or rupture or whatever, again, possibly a CPR injury, maybe a needle, when you're doing CPR, if they were trying to do intracardiac, maybe they went too far back with that. Is that because of the life-saving measures they were trying to offer, or was that really something that, was something inadvertently hit during the procedure? Surely he would have noticed the amount of blood from a liver laceration
Right.
when the abdomen was open. He or she, I guess.
Yeah.
Yeah, and
I mean, a
absolutely.
terrible case. I mean, it's very unfortunate.
Sucks.
Yeah, it really
Yeah.
sucks, but, I don't know. There was just some things there that didn't add up to me. If the liver was ruptured, lacerated, whatever, damaged to the point of exsanguination in the abdominal cavity, surely, unless somebody's just out and out lying about what happened pre or post or peri-surgical,
Well,
I think that'd have been really hard to, or really easy to tell at the time surgically. Again, now whether that happened during CPR, it said that somebody said that you always break ribs when you do CPR, and there weren't any broken ribs, so they didn't do
No.
CPR. I don't think
That's
that's
not true.
valid at all.
No.
Right,
No.
right. It's not. I'm not saying you couldn't break a rib doing CPR, but we do CPR a lot and we don't break ribs. So,
depends on
that
your
was,
training,
yeah.
and how go get it you are.
Mhm.
And I had a question on the necropsy report. It says there were 3 suture ligations in the abdominal cavity. Were
Right.
those like free floating to indicate that the ligatures failed? It wasn't clear to me.
That's not the way I read it. I
Okay.
think there were ligations of the vessels, but I had to read that a couple of times too. It didn't say that they were loose in the abdomen, I guess, but
I was kind of
Just says that
disappointed in
they're
that.
yeah, in the
Yeah.
necropsy.
Mhm.
I really, and then this supposition of, blunt trauma, basically, like the trauma caused it.
They
I mean,
kind of
I-
made
I
some
Really,
accusations in this necropsy.
And the
report that I think
PTH
were
and
a
all
little
that
far.
sure could have been from 30 minutes of chest compression.
Absolutely.
and most of the hemorrhages were on the diaphragm and the diaphragmatic surface of the liver.
Yeah.
Which would be right there in very close
Consistent.
proximity to
Absolutely.
where you're compressing the chest, so.
There's also a page 2 missing. I don't know if there was anything useful on that
Yeah.
page 2.
And then it says the affected skin.
It may have just been like a footnote.
The back page, yeah.
There's comment about the incision was well healed.
Yeah.
I said that because
right.
this was
Yeah.
an acute.
Absolutely.
And then when there were questions about when the actual surgery took place, it seemed like it was a lot.
Yeah,
That
we
to
skipped
me,
the
longer
dog
that to
out.
me didn't make
All
any
this straight to
sense
the
as part of
diagnostic.
the,
Yeah. I wasn't, I didn't really think that was, damnable evidence of anything. It seemed,
I mean, I think everybody knew when the surgery took place, so.
Mhm.
to me, this
He
seemed like
even
it was.
signed the consent form saying something like this could
Really?
happen. The owner also declined blood work.
Yes.
Right.
I think that it's one of those, like, these things happen. I don't think there's any actions that we can take to either change the
I don't
outcome
think there's
or
any way to
prevent it.
prove that
The
there was
medical
an
I
record.
did have one thing on the medical records that I did wanna kind
Yeah.
of point out, that in the written record of what occurred, you know, of that day, they have 1 cc of butorphanol on there and 0.5 cc's of ace-promazine IM. And then they went ahead and induced with 0.6 cc's of telazol.
Mhm.
You know, and then it looks like they intubated and, you know, maintained on isoflurane gas. Later on in the record, when she wrote, her response and what she gave, she said she gave 0.05 cc's. So a half cc of ACE is a fair amount, you know, I mean, again, that's no problem with that old school protocol. But, I liked down here lower where I saw where she said, I drew up a combination of 1 cc butorphanol and 0.05 cc's of ace-promazine.
It says that in the record.
I beg your pardon?
It says that in the record. There's a line going through it. It makes it hard to see, but it does say 0.05.
5 IM,
0.5 cc's ACE IM,
along with
And
your
that's
one
what I
CC.
read.
Mhm.
right? So I had 0.5 cc's in the written record,
I'm looking
and
at-
then in her response, she had 0.05. It's something that needs to be rectified at some point.
The
and-
rebuttal says
mine-
0.05.
Yes,
Oh,
correct,
these
correct, the
are-
rebuttal does,
Oh.
Sarah, so
It's different.
that was all.
It is different.
And obviously that would
You're
make a big
right.
difference in how hypotensive your dog is.
Mhm.
Now, in fairness to that veterinarian, I have given more than that to, if that dog was, we'll call
Aggressive
it
in the
politely
room.
boisterous in the room,
Mhm.
you.
It's still
probably
within
every
the dose range,
veterinarian I
yeah.
know has popped a dog with a pretty good dose of a tranquilizer
Mhm.
to get it under control where you could work on it.
Yeah.
So, that's
You are
a
pretty
little bit
clear.
of splitting hairs, but there was a difference there.
And one thing I think we need to just on future case, these were scanned in and we printed, stuff got way.
Yes, yes,
Yeah.
And
it took me
was-
forever to get it in
It was
order,
a
yeah.
struggle, and I think
Yeah.
it becomes important when we try to see what was submitted by the veterinarian versus what was submitted by
Right.
the client.
Right.
Because it does look like what was submitted by the client is slightly different than what was submitted by the veterinarian.
Right.
If I look at what was submitted, I think by the veterinarian, it looks like maybe, and it may be a simple mistake of writing 0.5 and then realizing that
100%.
what
Oh,
you did.
yes.
Mhm.
No,
But
this-
then she did add the two op PDS. And there's some charges off to the side, which I think she blanked out when she gave it to maybe the client or something.
Yeah.
No, I don't think any of it's damnable by any means, and I agree with Dr. Williams that you sign that consent for surgery and you tie their hands in not doing pre-surgical blood work or pre-surgical workup. And when you and I go to the hospital and they insist on a chest x-ray and blood work and everything, it's to
There's
prevent
a reason,
this kind of
Yeah.
stuff, right? And so, and then it seemed like a lot of this complaint was that someone at the state lab, kind of made the stretch that this may have been some kind of traumatic injury, which in my professional opinion, I do not see how that would be
Yeah.
a reasonable conclusion. And then this poor client, who's already lost a dog, now has the presumption that someone injured his dog.
Right,
And I can't blame this poor man for going where he went,
right.
but I do wonder about vet number two, kind of also surmising maybe there could have been. I would not have been that vet number two. I mean, I would have certainly read that report and interpreted it the way I've heard you guys mention,
Mhm.
the hemorrhage on the diaphragm, hemorrhage on the diaphragmatic surface of the liver, that would be consistent with trying to do CPR.
Aggressive CPR.
To me, it read as a very unfortunate
Oh, yeah.
accident
Yes.
that sometimes.
I don't blame this
happens.
client for being upset, angry, hurt. I feel every emotion this poor person has, but I don't think, and then I couldn't agree more. This second veterinarian to say, well, bring it to me and we'll submit it. you know, that
would
dog
wanna get
needs to go
involved.
straight to the diagnostic
Yeah.
lab,
Yes.
you
Yeah.
know.
And again,
so-
especially since they had diagnosed it to begin, I don't know, that just seemed
Yeah.
odd to me that, because it was diagnosed by that
Unless that
veterinarian.
veterinary
Right.
doesn't do surgery or
Maybe.
isn't,
Right.
I don't know.
Maybe,
The
maybe,
DCPR that morning really hadn't even been established.
right.
And then it was an aggressive dog, it
Yeah.
had to be tranquilized, do anything.
I
Yeah.
can imagine being some kind of attorney and seeing that and going, well, then the minute that dog left, the care of the veterinarian
Dr.
who,
Kelly,
yeah, Dr.
Right.
Kelly, anything could have happened.
She put
Could
that
have been
in.
dropped
Yeah.
in it, right?
It's a
So
very good point.
that's really,
So
I would vote to dismiss. I'd like to make a motion to dismiss this
I'll
case.
second it.
So we have a motion and a second from Dr. Connor and Dr. Klein to dismiss case or dismiss the docket 2024-01. Any further discussion on this case? All those in favor say aye.
Aye.
Any opposed? Motion passes to dismiss. The next item on our agenda is docket 2024-02. Would someone like, this case is Marie Tate against Dr. Beach. Would someone like to summarize this case? please?
We have to do this one.
Excellent, thank you, Dr. Coco.
So, there was a puppy, I believe it's 8 weeks old, that was, Dr. Beach wrote a health certificate for it to be sold, to a client, I guess, in, New York. And, it was a client of his, it was a breeder, here in Arkansas. He did not a purchase exam, he wrote literally a small animal interstate health paper. They did check the worms, found no worms at the time of the exam. And, pronounced it free of communicable disease and safe for interstate travel. And, upon its arrival at the new owner up in New York, they found it to have a, let's see.
An underbite.
Underbite on the puppy. And then also commented on bowed legs and roundworms. And, sounds like she certainly was not happy with the quality of the puppy she received. But for some reason turned in Dr. Beach for, that he, I guess, had certified that this little cockapoo, 9-week-old cockapoo, was free of any kind of genetic issues or, his response was exactly that I didn't do any kind of pre-purchase exam for Miss Tate. She's not my client, and that was not the purpose of the visit to my vet clinic. It was that I was not sending a sick or contagious animal to New York. And, that's what I charged my client for. You know, and in my mind, when I read this, I think this Miss Tate probably has a complaint, but it should be with the, breeder.
Mhm.
And I really don't know why the veterinarian would be involved in the middle of this, to be quite honest with you. So,
Except that you have,
Was this,
no, I was just gonna say,
Go ahead.
this.
was
is
this sent to the buyer or do we know?
It
I
was-
was not clear on that.
Yeah.
Mine, well, again, everything was kind of jumbled in this one, but
Mhm.
it looked like this was submitted by the client that's got the complaint. That this is what Dr. Beach wrote out and said everything was normal. You know, it goes through all the different systems. Doesn't indicate that there is any issue in the mouth or the legs. You know, where I struggled is if you've got this massive overbiter or these leg issues, where's the pictures? Like I would have liked to seen additional pictures, but to me, if you're the veterinarian and you sign off that everything is 100% normal, even if it's not a quote unquote pre-purchase exam, you've examined the animal and said everything is normal.
But you may have a point there now,
Is this
and
Lynn?
which puppy would this be? Cause it's not identified other than
That
the
was,
puppy.
that was the other thing I
There's
struggled, is
3
it the
different
same
names.
puppy?
So,
There's,
yeah,
Cockapoo
health check
male,
times 1.
weight and age, but there's no
yeah,
definitive identification.
The black and
that
white
this
is the
is
only
puppy.
thing we've got to go on that. I wondered that too.
Yeah.
and it's referred to as Klaus, puppy, and chief, which, I mean, could be just from the different owners
Different owners.
through it, but it's
Chain of custody of
odd.
the puppy is hard
Right.
to
It's,
follow.
yeah, like, are we
Yeah, I-
100% sure this is the same puppy? I don't think we can say it is. For
I don't
sure.
know.
I mean, a black and white cockapoo, a dime a dozen.
Dr. Beach health certificate was just for a movement.
Yeah,
Right.
And it
Exactly.
And
looks
that's
like
all he
the-
charged for, right?
And that's
Is
all he's
right.
charged for.
Right.
is the international or the
This-
interstate health certificate.
Page ended up going with the puppy, then I think the owner kind of did some discredit because he didn't do a pre-purchase exam, he did a movement
Mhm.
exam. And this document was potentially provided to the breeder, so they could have interpreted this as this was their pre-purchase,
Mhm.
but that was not the
You
doctor's
can
intent.
imagine, yeah, I mean, to me, we're not certifying when we do through the interstate travel health certificate. And that is what he charged the client for in Arkansas. Now, granted, and I agree with you, that big long checklist of all the things that I looked at its eyes, basically, I looked at, and so in looking at that,
I also wonder how bad these were, because like, if you look at the second veterinarian's records, it says underbite, suspect mild maxillary breaking nanism.
Right.
Right.
You know,
It doesn't sound-
Mild
well, and they
bow-leggedness,
found
like,
one round.
One round one.
one roundworm, like, sometimes you look at these dogs, you look at so many of them that it kind of becomes like a normal thing to you.
Right.
Oh, small dog with an underbite.
Mhm.
Yep,
Cockapoo.
it's a cockapoo.
Again, you would assume that the buyer and the seller would have exchanged pictures and would have gone through all that stuff. Again, it didn't sound like that was what he felt his duty was at this
I don't-
point. Again, I think either just presented to him for a health
My
certificate.
veterinarian said,
Nothing contagious.
well, imagine in the horse world, this is a big deal. You're
Yeah.
writing a health paper, so it can go from state A to state B. Is it contagious? Is it safe for
Right.
to travel?
Gravel, right.
It gets
Doesn't
to
mean
the
does he
other
have
end
club
and
feet or.
Throws the new owner, and now suddenly there's this litany of things that are wrong with the
Yeah.
horse that the vet that wrote the health paper should have known. And no,
No.
there's no
And there is
liability
a
on that
common
veterinarian.
misconception that a
right?
health certificate
Yep.
implies more than just
And many of the
contagious
trainers and the
disease.
breeders and folks like that try to put the vet in the middle of it for its purposes.
Absolutely.
health.
You wrote health certificate.
So one of the things we actually put on our receipt is this in no way implies the quality of the puppy that you
Man,
bought or the horse.
That's
We're
smart.
not getting in the middle of that.
That's smart.
And the reason is stuff like this.
Yeah.
So it would behoove Dr. Beach to protect himself better in the future. And I'm not sure how thorough he was or was not, because again, I had no proof that this was the puppy that he examined.
Right.
So that was why when I read it, I just said, well, ma'am, it sounds like you have an issue with your breeder.
Mhm.
And the other thing, I think we're on the same mindset, but just to point out is that this was 1/17/24 in an 8-week-old puppy.
Mhm.
He was seen on 1/22/24. These guys are still actively growing. You know, it's only a couple of days, granted,
Some little
but they are
puppy
still
bags.
actively growing.
Mhm.
So things could change between point A and point B.
To me, I think this Miss Tate in New York certainly has a valid complaint with the breeder
Sure.
if she got a sub-quality puppy. But for Dr. Beach's health paper to be a guarantee of any of that.
No.
I didn't see it.
I'll make a motion to dismiss, case 2024-02.
I'll second.
We have a motion and a second for dismissal of case 2024-02. Any additional discussion? All those in favor say aye.
Okay.
All opposed? Motion passes for dismissal. Next case is 2024 on the docket 2024-03. The complainant is Dwight Lindholm against Dr. Karen Pallone.
So Dr. Karen Palone's my ex-wife. We're partners in this clinic that is being questioned, so obviously I will recuse myself. I will step out for this and then was there
Yes,
Yeah.
2024-05.
same guy, so I'll just step out for both of those.
Do we want to do 04 then? And then that way you can step out for 2 in a row instead of come back and come back
We
out?
can just do these two after each other and then bring it back in. Yeah, okay.
That's fine.
We can do that. I'm okay with that.
Okay, sorry. No, I'm gonna take my water bottle over.
Somebody want to give us the summary on this one?
I put the easy one on purpose.
Yeah, same here.
Yeah.
This one's a little
This is
confusing.
convoluted one
I'll
here.
start on this one. This is a complaint, stating negligence, towards, Dr. Karen Polone. It is a convoluted case. The underlying is, the thing is the dog was presented, to the clinic for exam vaccines. Basically, it has to do with the dog had previously been diagnosed with heartworm disease, was on doxycycline, came to the clinic. There were some positive tests and negative tests and interpretation of tests. They did do chest x-rays and a little workup on the animal, and started the animal on the recommended dose for doxycycline as to begin the heartworm treatment, which he was already on from another clinic. So she recommended doxycycline at the appropriate dose, and he said he already had some at home. And then comes the second case,
Yes.
because the prescription was then filled by Dr. Polone. And there was a misinterpretation of the label on docket
2505,
05.
2405.
So as far as Dr. Karen Polone's involvement in the complaint of negligence, I did not find anything that I would really be concerned about or find that it was negligence. There's some interpretation of some testings and the process of the testing. But
The only thing I can say is I've had this happen to me in a clinic situation where the dog was positive, we got a negative, and then we got a positive, and we did the microfilaria smear.
Mhm.
We sent it out to a lab, we called the lab and said, hey, what do we do? We're getting all these different tests. Like, what's your next recommended step? Do we use a different lab? And so, we took those extra steps to truly figure out an answer for this client.
right,
Something that I think would be helpful would be to get records from the first clinic
Mhm.
to see if they did that, because it'd be very different for a dog testing positive at the first clinic with a positive microfilaria and then coming along into the situation versus, the first clinic didn't do the due diligence.
Well, you know
it did
that,
put her in an awkward situation because
Yeah.
they came in, an American Association of Heartworm, that they
American
have.
Heartworm Association, yeah.
Yeah,
You
that
got
one.
this, you got
They have
this.
very clear guidelines, and they
Yep.
have revised their guidelines on how to handle a heartworm positive case as far as the initial testing. I think they did a witness test to begin with.
Mhm.
And then, in my practice, we do a microfilaria as well.
Yeah.
And then if it's positive, and especially with his history, repeating the test with a SNAP.
Yeah.
Would give you additional information or a send out at that point.
Mhm.
Well, here's my question. The owner's complaint, he says, and this dog's been on heartworm prevented all its life, in parentheses, ivermectin. Now, ivermectin, now is this a Heart Guard product, TriHeart, or is this guy squirting ivermectin from the farm in the dog's mouth? And if he
Exactly.
is an appropriate dose. And my concern when I was reading this complaint was you started here, you're giving something from at home or from the other clinic. Yeah, and I'm with you, if one of my young veterinarians in one of my clinics came to me and said, I would go timeout.
Yeah.
Massive cluster ahead,
Mhm.
Start
let's
again.
start from zero, let's
Yep.
dot our i's, let's cross our t's, let's do, a snap test and let's look for microflare and let's send this out and let's, now in fairness, sometimes when those people come in, they don't tell you where they've been. They don't even tell you they had a previous negative.
True.
They, I was looking for in this record, did someone then go, well, we have a positive, let's set you up an appointment to do the screening, to do all the other stuff.
Mhm.
I didn't see this in the record, but I didn't see where it was offered or declined. Like the client didn't say, well, the client just, I went in, it was negative, then I went in, it was positive. And then I may have gone back to the other person to get some doxy, but I need a refill of doxy.
Yeah.
Like when I was reading all of this, there is absolutely no chain of command on what happened when
Yeah.
and with whom.
Yeah,
You
a
know.
lot of back and forth
Yeah.
between veterinarians. He did, I think there was someplace in here where there were things that were referred to by trade name
Mhm.
in heartworm preventative products. So my interpretation is when I saw ivermectin, it was straight up
Ivermectin.
Mine too.
Yeah.
Yeah.
not.
again-
From the
That was
bottom,
yeah.
my thing too.
Again, having the records from the previous clinic, we may see Harker, or we may see owner does ivermectin on his own from feed store.
Well, that was there's just so much back and forth, this little helter skelter that, I mean, at some point, the vet is responsible for the care of that animal, you know, that,
Yeah.
but you're not to know everything that owner did on their own unilaterally before they walked in your clinic.
Right.
That's, so that was the concern I had, is that, well, the second time maybe when he came back in and said, well, I left you because you said it was positive and I didn't come back for, I was looking for some documentation of some
Mhm.
kind saying that we recommended this would have been our follow-through plan, and the client left, and a year later he showed up again. I mean, and with doxycycline and wanted a refill. I mean, that's those types of clients, you really do hit the pause button and you go, what in the heck is going on here? You
Yeah.
know, and
We have
so
medical records to indicate that. And that,
I was hoping to see that.
I did not
and that was-
see the medical records to indicate, you know, did they attempt to contact the previous veterinarian,
Right.
to request those medical records? To at least give the attending veterinarian the database of information that they would need to create a treatment plan.
I personally didn't have any problem with the fact that someone screwed up and filled that script for twice the amount. I didn't think that, it was a mistake.
Mhm.
It looked like they owned it, they corrected it. Fortunately, there was no permanent harm to the dog.
Yeah.
So as far as any kind of litigation or anything like that, I mean, that was a mistake. And that
Yeah.
happens in human pharmacies with human doctors and veterinarians. And thank goodness it was a correctable mistake and it was not a permanent, there was
Yeah.
no permanent. So, you know, I think that was the client's final straw on, like, this has just been a nightmare. I don't want to do business here, you know, and I was trying to kind of sort my feelings out with, well, is this just, this guy needs to go be happy somewhere else, and maybe he'll find that one clinic and he'll stay in that clinic and follow
Yeah.
through with the case all the way to the end. I had some severely,
The part about asking for the previous clinic's medical records, but I also got the impression that basically that dog came in, they said, hey, we're here for treatment. Dr. Plum basically kind of went, okay, well, let's do our own testing,
Yeah.
and she kind of started over from scratch at that point, like,
Yeah.
hey, I don't have those medical records, so I'm gonna go with what I have here. And I got a little helter-skelter on whether it was really on preventative all the time.
Yeah, and then I also saw a note, where was it, about how the machine read it as negative, but there was a very faint blue mark on the test, but it was declared negative.
right.
And I was also, I mean, I thought we were taught that if there is any mark at all, it's positive, unless it ran.
Depends on if you're using the reader. If you're using like a Snap Pro
Uh-huh.
and that time has elapsed
Sure,
and you've got
Sure,
that
sure.
recording, that's it. That can't come back 15 minutes later.
but
and go,
within your 8 minutes, I'm less familiar with the witness test,
wit-
though. I'm more familiar with like the IDEX snap.
Mhm.
So, I mean, if someone wants to weigh in on the witness, but like, I mean, I was always told that like, if there's a blue dot within the correct time period, it's positive.
We don't know that because
See, we-
the
right.
machine.
Read it
because
as
this was-
negative.
The machine read it as negative.
Yeah.
So if the machine read it as negative, it would be like your Snap Pro.
Yeah.
And documented as a negative.
Makes sense.
And then the interpretation of the blue dot, was that within the 8-minute timeline? Or the, we
Yeah,
don't know that. We
we
don't
don't
have
know.
that information.
What do we want to do about it? And that's,
I mean, the complaint is for, you know, on the Practice Act for negligence.
It was interesting, they added, the other thing I'm commenting is they added the addendum about the faint blue dot
Mm-hmm.
on 5/16/2024.
Mhm.
The
Yeah.
test was run in November of 23. I don't know about you, but I don't remember 6 months later.
Oh, from the, like the rebuttal addendum?
Yeah, I think there's
It was in
two
the,
addendums in the
excuse
record.
me, in the medical records added as an addendum.
I was looking for the negligence and, I didn't see negligence. I saw miscommunication and a little sloppiness in a way as far as, and I said, I didn't really feel like that was, how many different people could you blame this on, you know, and,
I mean, the only thing I would say, maybe review heartworm protocol through AHS, you know, for secondary steps. But I kind of agree with you. If she got a negative test and the owner was like, well, they said it was positive. I got a negative test, so I don't need to take these next steps.
Microfilariae negative.
Yeah. I don't,
I really didn't, I couldn't find anything that came to the level of any kind of, gross negligence and,
Negligence,
yeah,
incompetence,
really-
or fraudulent.
and there was a case that I was indirectly involved with a couple of years ago with a previous board. And a client apparently had gone to, and it was two partners that had split up. There was some animosity locally. Totally unbeknownst to me, they went to one clinic and they gotten a positive and a heartworm, workup. They gone to the ex-partner and got a negative. And then they, so they came to me for like the tiebreaker, I guess. Didn't tell me any of it. It was negative. We didn't see microfilariae and it was SNAP negative, and so we called it negative. Well, that triggered a big fist fight between two ex-veterinarians and their client kind of thing. And it wound up in front of the state examining board, and at that time they said, because they complained against the veterinarian who called it a positive, saying they did it for money and they were going to try to treat a negative dog. And, the examining board at that time supposedly weighed in and said, interpreting a test, positive or negative, is really not negligence or malpractice. If you determine it's positive and call it positive, then that's a physical determination, like you saying you heard a grade 2 heart murmur and I didn't hear it. So I don't know how much that has changed legally, but I would say a legal interpretation of a test, I don't think that weighs on negligence or malpractice. So
Documented in the medical record.
Yeah.
And client communication.
well, I'll, make a motion to dismiss, case 2024-03.
Motion on the
I'll
table
second.
to dismiss, by Dr. Klein. There's a second from Dr. Williams. Any additional discussion on this case? All those in favor say aye.
Aye.
All opposed? Very good. Case is dismissed. We're gonna jump to case 2024-05 since it is adjunct to the previous case we discussed. 2024-05 is Dwight Lindholm against Dr. Mike Colon. And this then is a follow-up case to the previous one regarding filling the prescription at 800 milligram instead of 400 milligram.
$800 would definitely make the dog have a
sick to
GI.
your stomach.
It would make them sick to the
For sure.
stomach. Um. I wasn't clear on I mean, this is dated 3/29, and then when the client communication, when it was caught, within a couple days,
Mhm.
because he called the clinic with the concern about the dog having some GI distress. The mistake was caught and corrected, and, he has, documented that the staff was retrained.
Mhm.
Many clinics will have, if the script is filled, you have another person sign off on it, or the doctor actually sign the script, what the hospital policy is on how do you ensure that those scripts are filled appropriately.
It's a took 800 milligram dose for a week.
For weeks.
Yeah.
With time.
And that's what's in the complaint.
Mhm.
Mhm. Well, I honestly didn't see anything there that rose to the level of mispractice, malpractice
Malpractice.
myself. That the first veterinarian in the complaint was not guilty of anything, the second veterinarian would not be also,
Yeah,
in
this
my
was
opinion.
an honest
It was
mistake.
an honest mistake, it was corrected, they owned it. Fortunately, there were no, I mean, aren't we lucky here? I mean, that dog, and, you know, I realize that that owner has added 2 + 2 and gotten more than 4.
Mhm.
But, it maybe needs to go somewhere they'll be happier. Totally cool with that. I didn't see anything worthy of a malpractice, mispractice.
No.
I would move to dismiss docket 2024-05.
I'd second that.
So we have a motion and second from Dr. Williams and Dr. Connor for dismissal of docket 2024-05. All those in favor say aye, or excuse me, discussion. All those in favor say aye.
Aye.
Opposed? And for the record, let it be known that Dr. Mike Malone was not present for docket 2024-03 or 2024-05. Okay, we'll move on to 2024-04, Linda Harrison against Dr. Bob Sapecki. And let's wait for Dr. Palome to come back in. I'm assuming that's where Dr. Niles went.
Yeah.
And
And then after that, I say we take a quick recess.
then, okay, because then we like to get an update where we are with Dr. Z
Let's add that to
after break.
after break.
Okay.
We'll put that into new/old business. So we are on to docket 2024-04. Dr. Plum has rejoined our forum. So this is Linda Harrison against Dr. Bob Sapecki. Who would like to share the details on this? I can do it.
Kind of a rewind of.
Yeah.
I can try.
It's an easy
I was
one.
gonna
So
say.
this is the case of Rosie that has presented for diarrhea. Was admitted to the clinic and then the clinic for multiple subsequent days after. When the owner picked it up, Dr. Sapecki talked about this bulging eye, that had, from what I could tell, had not been any part of the conversation in any of the phone calls. And then had a protocol that the owner was supposed to take care of this bulging eye. And then when that did not get better after a couple days on the recheck, the vet subsequently says that the owner did not stay in compliance with taking care of this dog. And apparently the diarrhea cleared itself up very quickly, but then we had a case of bulging eye.
Yeah.
Little contrast media and little.
So this-
Yeah.
It's the limit.
I'm sorry if I don't know how to separate it any better than that.
Yeah.
That's my attempt.
Oh,
It's a good try.
Thank you.
Right, you did great.
And they did seek additional consultation regarding the eye, and
Yeah.
the dog had a proptosis.
Yes. And
Yeah.
The
They required
initial-
an
Oh, and
enucleation.
enucleation, right?
Yep.
Yeah.
Yeah, so it ended up losing the eye. The notes talk about a scratched eye.
Yeah.
Versus a bulging eye versus a proptosis. We're talking about, an array of clinical signs.
On his notes, it says
Treatments.
that they talked about the eye. She never mentioned the eye initially.
yeah.
Right.
Well, and then he blamed her for putting the piercing in the eye and not
Right.
following the treatment protocol, the treatment plan. And of course, in her complaint, she said she was told to use those drops 6 times a day and give her the antibiotics as prescribed. And, the eye was bulging out of the head. So she indicated that it was very obvious the minute she picked up the dog.
Mhm.
I was kind of curious, the 6 time a day that he recommended had a steroid in it.
It did.
and they
Yeah, so
set
that
on the
had
eye.
Yep,
Fluorescein
So-
uptake on both eyes.
Yeah.
And you also got that Dex cocktail
yes,
Mhm.
Yeah.
twice.
got it.
So,
Got it.
More
you know,
steroids.
to me, steroids, if you have a very minor scratch on a cornea, you can probably get away with it, but if you have much more going on than that, it's fairly well-known medicine to not put a steroid in an injured cornea.
6
You
times a
know,
day.
yeah, and so that seemed, even mupirocin or no mupirocin, that seemed like a big mistake. And then,
They also
I
had a
don't
hormone
know.
test.
obviously, he didn't address his comment about, I asked her 3 times and she never answered me. I mean, that's so unprofessional if you did, right?
Yeah,
I asked the dog and she didn't tell me.
Yeah.
And just looking at this on its own legs and not trying to relate it to anything else.
Also,
Things.
I think,
sorry, that was interesting that there are no notes from 4/30/24.
Yeah.
There's no observations, nothing
medical
from that
records.
day, other than the dog's gonna stay.
my
For
thought was-
observation.
For observation,
Observation, yes.
Without
But
us.
that was not
But
documented.
the standard of care for an ophthalmic workup, he checked pressures
Yeah,
a couple times.
No stain.
that's totally-
There was no stain.
Mhm.
Typically, in a presentation like that, you're going to do a fluorescein stain, KCS, or a corneal stain.
mhm.
Those did not happen upon presentation.
Does it even say that he administered the eye drops while the
No.
animal was in the clinic?
It does not say that.
No.
And he's documented other things that he's given it in the clinic.
Yeah.
Mhm.
Correct.
You made sure to check 9 times and a heartworm test
Mhm.
and give that Pendex B12. And he documented that he gave Reglan, but not
No.
anything about eye drops.
But not an ophthalmic workup.
Mhm. Well, in fairness, in any other situation, had that eye injury, just, that little Shih Tzu reached up and thumbed its eye 30 minutes before it's headed out the door for its, cured diarrhea. That scenario could happen.
Sure.
However, so there would be no real documentation of a treatment within the clinic and there would be no communication with the client about an eye. If
But
that
you
were to
think that
happen.
as soon as that client left, someone would be on a computer
Oh, very
going,
much so.
patient proptosis eyes 30 minutes before discharge, da, 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 da.
So I kind of was reading through the client's thing and all the things she accused Dr. Specky of, and of course the nasty, dirty clinic. I'm really hopeful that down the road we have someone, we can't pass judgment on that here. I've
No.
never set foot in that clinic.
The other- To your point that you just made earlier, before you go down that road, 'cause I
Yeah.
think it's a very valid road. It says in his response, it was apparent at first examination,
first
there was a
exam.
secondary condition
Right.
being an exuberant amount of eye rubbing. So it wasn't
Was
a 30-minute
clued in.
before that something happened.
Yeah.
There was something in his mind that had happened before. So
Correct.
anyway,
Well,
now you may go
But he
down.
did they checked, pressures
Pressure.
Yeah, he keeps
And that's
noting
the only
inflammation. of the
annotation.
RS spasm.
about any ophthalmic workup.
Because this is kind of hard to say.
No, it's, I hardly know where you start, but and again, trying to take each individual case as its own thing. And saying, well, on this merit, and in many of these cases, we know as he said, she said. She said there's nothing wrong with the eye, he said, apparently, no, there wasn't either. On intake, they both agree the dog seemed to have no problems with its eye. So, in his rebuttal, then the dog had been rubbing its eyes or was a chronic eye dog. But then we go into the, and then, okay, did he legitimately give it barium and did it have some kind of an obstructive problem? And, I think if we were allowed to tie them all together, we see a pattern.
Yeah.
On its own merit, not a hangable offense on any one of those things. 6 times a day with a steroid in the eye, I think is incompetence or negligence.
With no
There's
workup.
any real, right, yeah, with no workup.
Yep.
And,
well, didn't he continue that after the fluorescein
well, the
was even
3-day
positive?
follow-up is when he then,
Yeah.
according to him, he accused her of not doing what he'd instructed her to
Where did
do.
he do the fluorescein? Cause
Yeah, there is a mention of fluorescein staining of the.
There is. No,
Later,
Later, yeah, it's
Yeah,
after,
later.
it's on the
Okay.
recheck, yeah.
At the
Oh,
3
Both,
but not in the
both
initial.
eyes took up.
Okay.
So
But
then again,
On the clinical
you
record?
could go to an ophthalmologist, but she's a quack kind of thing. And then granted, he said, she said again, but the idea that you would try to refer someone to someone more competent, that would be an expert, that would be the proper thing to do as a veterinarian. So look, you know, you're concerned, I'm concerned, this technically happened in the clinic. It's kind of like the first veterinarian with the dead dog from the neuter. And what was her first response? Get it to the diagnostic lab. I would like to know, I will pay the bill.
Mhm.
I want to know what happened here. I'm not trying to hide anything or brush it under the rug. I would like to involve someone more highly trained and more professional. And this is kind of the opposite. Just hang in here with me on this and we'll kind of, so again, a big mistake and that is a mistake in practice and in practice judgment, in my opinion.
Would the committee like to have an inspection of this clinic
Oh, 100%.
Yes.
based
I
on
think so.
the findings of it was nasty?
100%. Yeah, that was an accusation, right? That it was nasty.
Yeah.
How do we, what's the process to request that?
That's
Well,
not a penalty in any way, so that would not have to be approved by the Arkansas
Yeah,
Livestock
that's
and
fine.
Poultry.
we can do that at any time.
Yeah, it's in the rules we, I would have to get in contact with this particular doctor's attorney, because he does have an attorney that
Mhm.
represents him on all cases, to let him know, or just to, however rules require us to let know, or to schedule a visit or something like that, however it's done in the past. I'll have to jump through those hoops, so y'all can do that. That's on me, but other than that, yeah, y'all go. Y'all can take Billy with you if you want to, just to hang around, or if you don't want to, y'all can show up.
Who does the
Okay.
inspection?
Yeah, really.
I would
Who is-
recommend myself and or Dr. Moffett. Probably being our first time, it'd be both of us.
Whoever's deemed the expert to judge that.
And you said Billy, I don't know who
Who's
Billy is.
Billy,
He's
sorry.
a law enforcement.
Okay.
Oh.
And another thing, more of a nitpicky lawyer deal, there's a lot of check marks on this complaint.
Right.
Yeah.
And y'all have the ability to go through and address the issues that y'all see based on y'all's reading. Let me help you out on statutes, rules, all that. I don't think that you have to address every single one of them if you don't think it applies, but there's a lot going on here, and we may need to, y'all are doing just fine, but to wrap it up, whenever y'all are done discussing, it may be good to just really section this out, because there's a lot going on here. Medical records, there's conduct, there's, all sorts of things, but that's just more of a lawyer thing.
Quick question for the visit side of things. Does a certain number of board members have to attend?
Oh, no, it's just, it's.
No,
No
none
committee
do.
member, no
Okay.
board member.
It's
Okay.
either you or, well, the previous rule, when it referred to the board, it said the board or its employees. Well, that would infer the staff or livestock hopefully.
And under normal circumstances, it can be announced, unannounced, but in this situation in which there's an attorney involved, that
It'd be probably.
Like I say, if I were that attorney, first question I'd have is, Dr. Connor, are you qualified to go in and inspect a clinic and do you have any certification? No, right? I mean, so that's fine. I think that whoever does go has to be, whoever is considered to be the authoritative,
Mhm.
judge of that.
So
So,
does it say what kind of advance notice you gotta give?
It does not.
Is
And
It could be 2 hours before.
jumping through hoops is my deal. That's, if y'all want to send them, then I'll.
It does say there has to be advance notice, though.
It
It does not.
does not.
Yeah,
I don't
I
think
mean,
there needs.
cleanliness of the clinic, then, yeah, you don't need to give advance notice.
But you have to go through the attorney who then you're
That's a
giving
good
him advance
question.
notice.
Because of prior history with this particular one and.
Yeah,
would be better.
And what defines, I mean, when you go to do a premise inspection, You're just looking at the physical facilities as outlined in the,
I think a good reference would be, the AHA regulations and inspection.
Good.
AHA
It's
standards.
pretty laid out in the
I'm
rule.
about to say it's laid out in the rules, yeah.
We'll start with our rules.
Really odd, you don't even need to meet all guidelines,
Yeah.
you just need to meet the.
That would be above ours, I would think.
Mhm.
It may not even be an official notice or letter, it may just be a courtesy call to the attorney within an hour or so before something happens.
would you look at controlled substances? Just look at facility and look at lock boxes? Are there
I think
any-
we narrow our scope to this because we're here, because it was in a complaint, and
Yes.
Of just cleanliness and
let
facility.
that guide us on our visits to a clinic. And that could-
Reasonable to me.
You know, if we're there and we notice something else, then we come back to you guys, oh, by the way, we found this as well. And it's real quick, get in, focused, open the door, take a sniff,
Yeah,
look around.
I would think if it's
Okay.
something blatant with DEA, then we'd be getting the DEA involved.
Yeah,
Sure,
Yeah,
that'd be a
but
recommendation.
Just so that
maybe
we've
there
got
at some
our
point, yeah.
expectations of
Yeah.
what kind of report you would give us, just
Fair enough.
facility wise would be appropriate.
yeah. And we'll, I know somebody that makes really good forms.
There you have it.
I mean, we've all agreed in the previous meetings, I mean, it's time to do something different with this veterinarian,
Yeah.
and so I don't know if, has anything been done since the last meeting as far as setting the hearing, or?
There is one hearing to be scheduled by the Arkansas Livestock and Poultry Commission on a compliance issue. We brought it directly to the commission since it was a follow-up on a prior board decision. Commission subsumed those powers, and so it was not brought through these channels here. And also so that we could have the veterinarians that are also commissioners not hang back since they've already seen the docket already on, since it would be a judicial type deal. And I won't share any sort of details, so once y'all hear the docket, that's the first time that
Gotcha,
y'all
yeah.
hear it. There's other consent agreements that have been sent to this particular veterinarian based on prior recommendations. And this one here can be new and fresh, we can decide the penalties here, y'all recommend it to be further.
Sure.
Another question for you is the clinic that it went to for the removal was one of mine. Dr. Martin works for me, so I don't know if I need to recuse or not.
The enucleation.
Yes.
That doctor is not a party in any way to this. That doctor could be someone as a witness. And on that, I don't know what the actual surgery would add to the previous conduct.
Sure.
Other than, I'm the guy that did the.
I just don't want to cloud anything if that's.
I don't
Okay.
think so,
Okay.
since you're not a party to this anyway, you're affiliated with Dr. Pecky or the complainant.
So Tanner, back to your original comment, I know we've got lots of check marks here. I believe what we've done in the past is take the merits of the case and looked against the rules and made our own decisions. So
Yeah.
can we somewhat ignore all the check marks that the client has and just go with what we feel? Or do we need to individually address all those different?
I would say y'all have the power to review this for anything, everything, all, half, quarter.
Okay.
Y'all are probably gonna hit some of these, with your determination, since there are a lot of check marks.
Yes,
But,
Okay.
So you may satisfy some of them. So get after, it, do what you're doing and do things.
yes, Dr. Knapp?
Point of order,
Yes,
Madam Chairman, lunch is here. And it looks like we've got a lot of stuff to work on here. If you wanted to break now while it's still warm,
Let's do that.
have lunch and then come back and be fresh and dig in on that.
Perfect. So we will adjourn momentarily,
And it's,
temporarily. That's the right
there's a
word.
buffet style set up. And I think it's set up that you can go out the door and work that way and then come back around and.
Cool.
Left, right. You guys can figure that out.
Thank you, guys.
Yeah.
Recording stopped.
Well, that is kind of one of the things. I guess they need to ask,
Yeah.
Whoever hit the room.
Most talk over.
This is our biggest number one.
That sounds better than my salad I had. We might let that tomorrow.
Yeah.
You see something like an expired bottle or something like that.
Facility
that might be
inspection,
something
adoption.
that-
Or skip the facility.
Do we do a full exam?
We can discuss this right now.
No,
I know.
We'll find something. Let's see.
When they-
They had a bear show up, you go to the vet clinic the other day, literally.
You had a bear?
Black bear, came right at the front of the vet clinic, tried to get in the front door.
He needed a dental
I was
appointment.
just hanging out, and then he just turned around and ran.
No
And
way.
went up and he went up a tree right there at the front of the clinic, and just hung out. Yeah, he just one of those little
No
yearling
way.
bears that,
Young male that got kicked out and he was.
yeah, he just out running around town, you know, and, came to the clinic.
He's telling me don't
Thing
accept
just-
his health insurance.
That's right.
Yeah, he was like, well, I need a checkup, maybe, I don't know.
Yeah. Bears have needs
Found that
too.
to be fun.
So he's eventually wandered off?
Yeah, you know, it was kind of funny, cause of course clients were like, there's a bear in your front, yeah, he's gonna hang out there a little while till
Like
he
your dog.
That's
he
right.
decides to go away, but. And he did, he kind of did his little thing and hung out. And look, there's a client literally right there,
Oh,
and here comes the bear. He's like, "Oop." And he went up the tree. And then he, you know, so, and then let's see this, let's see, there he is. He's right there by the front door, and then, like I say, up the tree, and then hang up the tree a little while. Yeah, you have to see.
Holy crud.
That's right
Where's the
there.
practice, where your practice at?
Mountain Home. It's just, I mean,
Yeah.
and the funny part is, like, I mean, I've got bear pictures from every neighbor, right, you know, it got really dry and it came to.
Yeah.
And they do it all the time. So you just have bear.
Are you backed up to some woods there? I mean.
Their clinic, actually, no, I mean, it's right there on 62-412, that clinic is, and so it's, yeah. There's all kinds of, you know, sort of woods up behind there, a little ways away.
Right.
But there's a giant golf course right there. Sometimes bears get out there and run on the golf course, and that's just.
That's great, yeah.
They all call, you got a bear up here? I'm like, I have a bear.
I have a bear, yeah. Didn't know I had a bear, yeah.
Some work with Game and Fish, but they don't own the bear either.
Right,
They just
right.
can get it if
Yeah.
it cares about stuff.
I think you have there.
Yeah,
Yeah,
you got a
sounds
bear
like
on
you
your
have a
car.
bear.
That's
great.
Isn't that fun?
It's the new hazard.
Yeah, one more thing.
That's
just
right.
Roaming hazard.
Sand traps.
Roaming gangs of bears checking themselves into bed.
No, it's not.
Thanks, sir.
Me too. You too. There, this is a typical.
We can put them on notice.
Yeah, it's probably difficult to do with an inspection. At any time, but we back off a little bit, but in this case, they're gonna give them time to, we won't give you all this trouble and y'all go away and give them time for that.
Oh, we can sell this for breeze.
Yeah, exactly.
I saw it. Yeah. It's, I was talking there, I don't think I was going to follow up with this attorney, but he's delinquent on all his considerations.
Well, I signed one more go on the.
That was
on the
that
10,000.
one, yeah, and that one was for that old complaint, he still had those other violations that, there's no way. If he wanted to just haul his rear end and gather 144 medical records for the past 22 years, he gets that to file one of them.
That's right.
If he gets into it, it's by Friday. Not even visiting.
No,
He ain't gonna do that.
Nothing to the CE. We don't have proof he's done anything to CE.
He can still pay his fine.
So do we have an audience? Your,
Our, service specialist.
is that the one I met?
Yes.
Okay, that's what I thought.
R Chick, Kara Mack, Jerry Garrett, Arkansas UBS, Tabby Stokes, as Senator. It's not.
So they're not.
The
one thing you have to. You don't.
Yeah.
Veterinary Medical Examining Committee meeting with the docket number 2020.
Recording in progress.
Which is Glenda Harrison against, case against Dr. Bob Pecky. We've had some initial discussions before break. I think the consensus is that there was probably some action that needed to be taken on this case. It's a matter of going through statutes and determining what, violations within the Practice Act that we deem appropriate. So, open it back up to the floor for discussion.
Well, we've read through the case, so have you got the list of the statutes? that-
I do have the
Yeah.
list of, I have the Practice Act in front of me. So,
Put it on the screen if you want it up there too.
Let's do
Yeah,
that.
let's do that, just work through them, yeah.
You want the practice act
You-
or you want?
do you
the-
want me to review what the
The
client
complaint,
decided?
yes,
Okay,
yeah.
so I'll
Don't you think,
review-
I mean, just go through those.
We can, and the discussion was we don't have to follow what the
Right.
client has indicated, but I will indicate what Practice Act violations we have under this. So number 5 of the Practice Act of 17-101-305, subpoint 5 is incompetence, gross negligence, or other malpractice in the practice of veterinary medicine. Number 7 is fraud or dishonesty in the application or reporting of any test for the disease in animals. Subpoint 8, failure to maintain professional premises and equipment in a clean and sanitary condition in compliance with the rules promulgated by the commission. Subpoint 10 is cruelty to animals. Subpoint 11 is unprofessional conduct by violation of a rule promulgated by the commission under this chapter. We'll come back to that, and go into the next section, where it discusses which rule. Number 12 is being unable to practice as a veterinarian with reasonable skill and safety to patients because of the illness, the use of drugs, alcohol, narcotics, or chemicals, or as a result of mental or physical condition. Subpoint 15 is overtreating patients or charging for services which did not occur unless the services were contracted for in advance or for services which were not rendered or documented in a patient's records, or charging for services which were not consented to by the owner or the patient or the owner's agent. That is the end of those. So let's go down to 11. Under the rules. Right, number 11, that's it. Yes. Back,
Violation of the promulgated by the board.
Yeah.
okay, so unprofessional conduct. I remember. You marked 11 above, please mark the corresponding rule for unprofessional conduct, okay. So F. Right, F, yeah. So F is for a veterinarian to undertake the care of an animal and therefore fail to render the care as generally accepted by the veterinary profession. G is to guarantee a cure. H is to make false or deceptive statements that belittle the knowledge or injure the professional standing of another member of the profession, or that unnecessarily condemns the character of his professional acts, provided here, however, that nothing herein should be construed to prohibit any truthful, non-deceptive statements, including but not limited to truthful, non-deceptive comparative advertising. L is being guilty of any dishonorable or unethical conduct likely to deceive, defraud, or harm the public. And O is conduct reflecting unfavorably upon the profession of veterinary medicine. So first thing we would need to do is look at the Practice Act, the first sections, and decide what within 17-101-305, and then should we decide anything in 11, we can go down into the rules.
A couple we could probably just exclude.
Okay.
Hmm.
Thoughts?
10 is cruelty.
I think she's,
Yeah.
was kind of insinuating that something happened at the clinic to hurt the patient's eye.
Well, maybe by not acting on a proptosis dye that it was cruel
Or was caused by,
or,
I was kind of reading between the lines, like,
So
he
that-
thinks that they
Yeah.
caused that to
Cause of
happen.
eye,
Yeah.
Yeah,
yeah.
But I don't think it's a way to
Cause
prove it.
his notes, again, he says on his initial exam, he noticed the eye.
Mhm.
But on nothing of hers, right, or did I miss it, that she never complained about the eye
Mm-mm.
going in, right?
No.
Never said anything about that. And in her, you know, in her part, she acted very surprised that he even brought up anything about the eye.
I had several problems too,
I mean-
because then later on that, you know, on the recheck, he blamed her for not having the e-collar on the dog. He blamed her for not using the eye drops that he
Right.
prescribed. And then she had even gone rogue and used a human ointment, not meant to go in an eye, in the dog's eye. I don't know what we do about that as far as and then of course, he said he advised her to go to an ophthalmologist and she declined.
Yeah.
So, you know, in the notes that had been entered, on his behalf, every single thing in there, practically, except for the neopolydex, you know,
Mhm.
would be a legitimate a veterinarian practicing good medicine.
Yeah.
You know, so,
So in her letter at the very bottom of the first page, she says, where it says, Dr. Bob is obviously very incompetent, dot, dot, dot. It says Rosie was obviously harmed by him or his staff. There is no way a 7-pound Shih Tzu can knock her on eye out of the socket.
Mhm.
So I think that's where that her
Yeah.
cruelty thing is coming from. I don't think there's any way to.
But there's no.
And
way to
He's
prove
trying to be
that, yeah.
fact-based, I think.
Justin, I don't know
Yeah.
if this is how we want to proceed, rather than focus in on excluding the ones that she has or doesn't have. Let's just approach it of what do we think is in, because we
Yeah.
don't, Tanner
Pretty
said, we don't
easier.
have to address all of her complaints.
yeah.
So we
Yeah.
can just bring about what we feel are the legitimate complaints.
Yeah, and if y'all wanted to even use her check marks and complaints as a guide, it's like, this, to help you organize it, they may even be.
Yeah.
It's practical.
So do we want to start with looking at 5, just kind of walking through 5? So 5 is incompetence, gross negligence, or other malpractice in the practice of veterinary medicine.
Well, neopolydex.
Steroids.
would be
Doing
a-
steroids
yeah,
with the-
steroids in the.
Without a
Would be,
thorough ocular exam.
Mhm.
Is that something we want to have as an item?
Yes.
Wasn't there something in here where he, after the stain uptake, he continued using the Dex?
Oh, yeah,
Correct?
yeah, that was his
Yeah.
treatment plan through and through.
Right, and so, I mean, he admittedly said that both eyes took up forcing stain, ulcerated. And then he didn't change his therapy plan, he continued a interophthalmic steroid, which is contraindicated, so.
So I'll try to record this as we go along so I can produce it again. 17-101-305 is incompetence, gross negligence, or malpractice. So our citing there is without complete ocular exam, diagnosed and treated patient using ocular steroids. And oral, right?
Yeah, I don't think there's any contraindication using systemic
No.
steroids.
Okay.
I'm not aware of
Just
that.
the ocular.
You just don't put it in the eye.
Pain
Right.
control.
Okay, so is that accurate
I think so.
That is.
for that one?
Yes.
Mhm.
Okay. So let's go through all of these and then we'll come back and talk
Yeah.
about ramifications. Let's not forget that this
Mhm.
time. Number 7, fraud or dishonesty in the application of reporting for any test or for disease in animals.
You know, again, if we can't use the pattern of this unknown material in these dogs' GI tract doing these variant studies. I mean, again, we've seen this in like 5 cases here now that we don't have any radiographs showing that there was an obstructive pattern, any reason, again, to hospitalize this dog for what, 4 days or 5
Mhm.
days? I don't know how we could, I mean, I think it's a problem personally, but I don't know if we can
Can you tie
bring
that to?
enough
Does it-
evidence
I
to
think we
prove
gotta
that.
leave it out.
Well, I also
Rise to the level.
wonder
Yeah.
why we're running a heartworm test and a clotting time on a dog that has some mild diarrhea.
Yeah, I mean, those wouldn't be on the top of my diagnostic test either.
No.
So, again, run an unnecessary test.
We also don't have the results for either of those.
And maybe the owner, he asked the owner, how
Maybe.
long has it been since we've done X, Y, Z? And the owner said, oh, it's been a long time. He goes, okay, well, that's, yeah.
But again, a
We
coax
don't know.
panel or
Right.
clotting time, I mean, God, it'd be hard to tie in with a
Yeah.
GI case,
Well-
unless he saw petechiation or
Pouring
ecchymosis that he
blood
didn't
out.
notate, but,
That states
Mhm.
fraudulent reporting and testing, right?
Fraud or dishonesty in the application or reporting of any test for disease in animals.
I think
That
you
was
throw
the
that out.
application.
And I really don't know how you make, in some of the earlier cases, if we're allowed to even mention that, is that some of the manipulations and things like that, when a dog came in for diarrhea. or
Yeah.
whatever, I think in that case, it would be totally warranted. In this case, I think we'd be fishing.
Well, we may have
Um,
more pressing issues that I think we can
Correct.
document.
Sure.
Okay?
Right.
So number 8 is failure to maintain professional premises and equipment in a clean and sanitary condition in compliance with rules promulgated by the commission.
how do we do that without an
I was
inspection?
gonna say, I don't think we can
I really
address
wish
that
these owners
here.
would take some photos
Yeah.
and include them in their report.
Yeah.
Yes,
That would be helpful.
so I think at this point with the evidence we have in front of us, there's
I
not
mean,
much.
can we
can do in
recommend
that.
an inspection?
As part of our finding.
I think we're
Is this the-
doing that as a separate matter, but maybe not. I don't know if we have a finding we can include in
I
here.
had some thinking on that and, after we break, and I think Patrick may have the same opinion, this may be, since we've typically done these by docket all the time, not gonna stop y'all from making recommendations and note them down for the minutes and then tabling this issue later. We may still go through the recommendations here today besides the dirty facility, but not send these recommendations over to the commission at the next meeting once we get information on however we wanna do inspections or anything like that, how that is practically, then come right back to it. Then we have our document for the commission. But I'm not gonna pump the brakes on any other part of this complaint here, which, yeah, like I said, pictures
Mhm.
of all of that.
Yeah.
Okay.
If that's what y'all want to do. If you don't, then we'll just do the whole thing today. So,
I have a question on, and we have these names of people who can confirm these statements, and are we expected as individual members to try to contact these folks and ask for their, like, did this, because these people are witnesses that we're making a lot of assumptions.
What's the point for
Without-
asking?
I had that same question every time I look at one of these, and I was thinking about it a little bit more this morning, because most of the time you pay attention to the rest of the complaint. I think these are here in case we do need further information. I would say we probably need to ask permission before we just run off and just contact them. We don't have a phone number though, on that, so we may call and complain it. But these are probably more intended for, say this goes to a hearing,
Hearing, okay,
and need witnesses to actually testify on this, because, and that may be the most practical way to do it, is what y'all are doing here as the committee is, even if y'all kick something up to a hearing, to the highest possible penalty, there still has to be a hearing, and that's when witnesses really come into play, so. I don't see anything stopping y'all from wanting to ask the complainant, hey, could you get permission from Mr. Danny Garrett and get his phone number? Do you mind if we have the attorney talk or Candace call, and would you mind providing a statement, anything like that? I don't think it stops you, but
well, there seem to be so many of these complaints that have the customer side of things. The client has, he said on 2 occasions, I asked the dog 3 times and it never told me how its eye got hurt.
Hmm.
Well, of course, he's making no note of that. That would be unprofessional conduct. That's something we ought to take very seriously and that should not happen. That's a total, I said he said this and he said he didn't say it, or I didn't follow the treatment plan and we were putting mupirocin in the eye. She says, no way. I did exactly what he said and went back 3 days later and these were my results. Well, those are two very, very conflicting statements. You'd think they need to be corroborated by somebody before we can make an informed.
Yeah, cause it rolls down to he said, you said so many times on
Yes,
this that.
I think we all have an inkling as to where we think it ought to be. But, and does that if this triggers a review and a hearing at Livestock and Poultry, have we just given somebody away, have we tied your hands to effectively adjudicate this kind of?
I don't think you would if you had somebody provide something written or even oral, statement. And if y'all wanted to have that to review as evidence there, it would then be on me when I would present this at a hearing to bring that person in to validate their statement that they had and also testify to things that they actually heard. But probably the most practical would be just bring them as a witness to hearing. I know how to handle that if I want to call somebody, since I've done litigation before, piece of cake, but that's just me talking practically.
I was curious if you had, like, would one of us be appropriate if we said, Candace, could you reach out to any of these three witnesses to see if they would issue a statement corroborating any of Mrs. Harrison's?
I don't think that's inappropriate, at all.
Maybe,
Could
what
that
about,
just be standard practice?
yeah, could we say,
That's
like,
what I
if
was-
you write this person's name down, they need to submit a statement? Like
Yeah.
modify our form essentially.
Wouldn't
just
that
to
help
say-
so much?
That's
Have
what
it
I was
ahead of
gonna
time.
interject is, do we need to modify our processing?
think
And if they
so.
have that on there, and we could do it a couple of ways, amend the application. If you name somebody, they have to give us a statement.
Mhm.
I would rather have that because I don't want to put more work on Candace.
Exactly.
I know it just pushes it down the road. for you, too.
Well,
I say, yeah, I'm with you. If
Right.
they're gonna put their name on there, then have them do. Doesn't have to be
Exactly.
making them-
They may be fine to put their name on here, but they don't wanna write a statement.
Yeah, right.
They're not knowledgeable. And we've seen some
Yeah.
We
other,
could prompt them to
documents
have a
which we
very
had
short,
witnessed.
obviously, we don't need a
Yeah.
30-page.
I don't know.
Would that be okay, or would that
I don't know how this was,
I tell you what, we can't decide if we need a motion on that, so could y'all make that a motion of the committee to amend the application?
See that?
We'll do.
and your point's well taken, because we have seen in other dockets where witness statements are included in the packet.
Yep.
Would be
So-
helpful.
Going back to this case, as we were kind of working our way through.
Yep.
I think we're on 8, failure to maintain professional premises, clean equipment. I think the discussion is, we don't have evidence to rule one way or the other on that one. Is that
Mhm.
consensus?
Yeah.
Right.
Okay, then let's move to 10, which is cruelty to animals.
I would strike it. I wouldn't,
No, that's why I brought that up.
I don't think we have proof one way or the other that he was purposely cruel to them.
I mean, she could have short stopped on the way home and the eye popped out. It's a Shih Tzu.
Yeah, that's why I would,
Do we have a definition of cruelty?
Do we?
It's not, I don't think it's defined in the statute, no, the statute's haven't been.
Well, obviously,
litigated.
And it's not under this rule.
Leave it out in the heat and the night,
So,
food and water, if you hit it or you.
And a lot of these definitions here, in lieu of, it's going for a circuit court on the appeal, which, luckily, not a whole lot of these cases have. Y'all as the experts, say, the legislature has set y'all up as to review these things to make recommendations to the other experts. So this is very specialized, similar to malpractice, anything like that. That creates an added problem. But it's almost kind of up to y'all, to a certain extent on how to think about this, but just intuitively, I would say cruelty as, typically is going to be defined as an intentional action, intentional malicious action with the purpose of inflicting harm upon another being. So,
So with that
Because
as your
the-
definition, no.
The treatment of the eye is not intentional cruelty, it's just,
Yeah.
it's negligence because it's not the standard of care.
Right,
Mhm.
makes sense.
Moving on. We have number 11, unprofessional conduct by violation of a rule promulgated by the commission under this chapter. Let's look at 12 and 15 and come back to that one, because I have a feeling we're gonna land on that one, and that one's more. Well, being unable to practice as a veterinarian with reasonable skill and safety to patients because of illness, abuse of drugs, alcohol, narcotics, chemicals, a result of many mental or physical conditions. I don't know if we have evidence that I know that. Okay. Number, Practice Act 15 is
Make
over-treating
me
patients.
facetious and say he asked the dog, but that's being facetious.
Over-treating patients or charging for services which did not occur unless the services were contracted for in advance or for services which were not rendered or documented in the patient's records, or charging for services which were not consented to by the owner or the patient or the owner's agent, is number 15.
I didn't see that.
I see evidence of over-treating under,
Undertreating.
but not over-treating.
Although, it sounds
Well,
like
the diarrhea
over
was,
hospitalization,
yes,
Hospitalization,
but,
I mean,
But maybe the dog was more nauseous or.
well, I'm making that judgment
That's
too from the pattern of
documented.
what we, like, just this on its own merits.
Mhm.
It's not,
but like, I feel like to warrant 3 days of hospitalization, there should be something in the record to indicate why this dog needed to be there. Otherwise, in my mind, like, the lack of documentation means
They-
there's no reason,
they
you just took
indicated
his time
it
looking at it.
successfully passed its foreign body, that, you know, the.
Yeah.
No documentation in the foreign body, but, you know. I don't know, in my mind, it seems like we gotta stick to the things that would stick. That,
Yeah,
I don't know,
I get what
I
you're
don't
saying.
agree with
We
that.
might be
Yeah,
able
because
to.
I mean, if it does go to hearing and that lawyer just starts really.
I don't wanna
picking
set him up
apart
for
all the
failure
little
and
things we
either.
say, it's
Stick
gonna
to the
really
things that I
discredit.
think are
Yeah.
the biggest
Yeah.
violators.
I
Oh,
think
yeah,
so.
I agree.
So then let's go
15,
back to 11, which is unprofessional conduct by violation of rule promulgated by the commission under this chapter. So if we go to that. Unprofessional conduct in the rules starts on page 13. We can look at any of those. The ones that she talked about were for veterinarian to undertake the care of an animal and therefore fail to render the care generally accepted by the veterinary profession. She put guarantee cure. I didn't see him ever guarantee a cure anywhere in there. To make false or deceptive statements that belittle the knowledge or injure the professional standing of another member of the profession.
Well, if he did say that's a quack, and,
Quack, right.
I mean, there were 2 unprofessional things. I asked the dog 3 times, this would obviously be incredibly unprofessional. And the ophthalmologist is a quack. And again, we're taking her words then at that.
Yeah, to me, that
So-
feels a bit more he said, she said. I don't know.
Well, I mean, the body of work makes it more believable,
Yeah,
but on its own merit. And again, maybe if you had statements from 2 other witnesses that, yep,
That's-
he said
yeah.
exactly that, I heard it,
Mhm.
well, then that gives you so much more gravity.
I mean, one option would be to table this, get those witness statements, come back to this, to where we can like do a full evaluation of this case.
And request a
make-
facility inspection.
Yeah, on top of it, and like, just, because I feel like this is a person that we're kind of circling around. And I feel like this is a case where we could like put in the due diligence and be like, okay, we finally have some black and white answers as to what's going on for this case.
You know, every case, well, other than maybe one against this individual there has been merit to the complaint
Yeah.
that was provable.
We've had a couple.
Nearly all of it, right? And,
Right. I'm
but-
just thinking in some of these that are
Right.
very he said, she said based,
right,
we haven't been able to do anything with. It's
Okay.
only been things that have been in their record.
or a recommended remedy, I think it will go toward,
Yeah.
you know, to me, I know in the past, we've seen where people submitted something, they altered the record and it was obvious, and it's
Right.
hands down, you've altered the record.
Yeah.
Right.
In this case, I looked for that, did not see evidence of it,
Mm-mm.
you know, and, the very clear cut, I mean, the problem I had was, it was unambiguous. Everything she said is not true and not accurate, you know, and well, now who do you believe,
Right.
right? And so, without any corroborating,
But if we have a
really
way to
don't know.
remedy that by asking for it.
100%, I think you're
we
right
Should.
for the,
So from the discussion, we could table this, as you said, ask for record or for witness statements
Mhm.
and, facility inspection.
I think that would give you so much more
I think it
clout
does.
if you trigger
think
a
so.
hearing and you get to go in there and say, we inspected it, we saw this, we corroborated this with witnesses. And they backed it up too.
Yeah.
Then if we do an unprofessional conduct, we have the teeth to,
And this is a
Back
case
it
where
up.
she's given us the most information about the clinic being dirty and needing an
Right.
inspection, because she talks about the paper crumbling and like,
Mhm.
there's kind of something to go on here.
Mhm.
I'll make a motion to table, 2024-04.
Is there a second?
A second?
So there's a motion and a second to table. Is there discussion? I would add the discussion is table with the idea
the-
or with the
Specific
specifics of a facility inspection and witness statements based on the complaint.
corroboration of the, yeah, these two.
And once we
reported-
have those two, it can come back on our docket.
Yeah,
And the only two witness statements, or the only three witness statements, because one's a veterinarian, would be from Danny and Courtney.
Yeah, I think
Correct.
Dr. Martin pretty well documented
Yeah.
his side of things,
He was the veterinarian that did the,
the
nucleated, yeah.
nucleation, yeah.
so the other two would potentially be the source of additional information,
Absolutely.
if they're willing to.
Right.
And this is a recent case. I mean, it was just submitted a month ago.
Okay.
May 24th is,
Very
So-
recent compared to.
Very recent.
yeah.
Many of the
I
other.
think we've got a little time.
So we have a motion and a second from Dr. Klein and I believe Dr. Williams. Is that correct, Katie? To table docket 2024-04 pending a facilities inspection and witness accounts being delivered to the committee. Is there any additional discussion? All those in favor?
Aye.
All opposed? Did they get your stuff organized? Go to the next one. Or maybe that was just me that needed it.
You're doing great.
Thanks.
Yeah.
Well, this is a big table.
That's nice. Just spread out all over.
You make quick notes on that, that's all we use for next thing. Okay, moving on to other business. The first item on our other business is Shelby Lowry. DVM appeal approval to take Navlee a sixth time. Candace, do you have, or Dr. Miles, do you have information on this?
And this you,
Does that mean she's
Yeah, ma'am.
asking to take it a sixth?
She's asking to take it a sixth time because Natalie says you can take it 5 times.
but there's an appeal process. And that appeal has to come from us. And on their behalf.
She's a new grad, just graduated in May or last year or when?
She's a new grad. She's working under we gave her a restricted license for now, which she's working under direct supervision of another veterinarian. So she has to have a supervised.
She's not actively on it yet. She
Yeah.
hasn't submitted all the information.
She-
We're working on doing that, so we can give her a restricted
Here's the
license.
Restricted license information from the practice act.
Yeah.
So she's not a veterinarian from another country
No.
that came here to take the NAVLE. She's a graduate that has failed it 5 times. And is
Yeah.
wanting to-
And there's an appeal process.
Can we give a restricted license? Cause
Yeah.
without that exam, she's
Yeah, I was gonna
not a
say,
veterinarian.
That's what this is for.
That's what
Okay.
this is for.
Oh, it is, okay.
I had a young graduate one time that failed to pass the NAVLE twice. Passed it on her third time,
Not past it.
but obviously when we hired her, we anticipated she would be passing the NAVLE, and so for a whole nother year, she was unable. We were told at that time as the board, we employed and paid her as a tech. Because we were, I mean, that was the rule. It's been 10 years now. She's a wonderful vet, by the way, now. I'm so glad we hung in there with her and, you know, showed some patience and compassion, but really, so is this a relatively new restricted?
As far as I know, that's been there, but we found that, first, you know, we thought, okay, they haven't passed it in 5 times, but the appeal process comes from the NAVLE. It's built in there.
Okay.
That says that student can sit again, but we have to appeal on their behalf to set it again.
So I have a question, like, how long do you let it go on for?
Give one more chance.
This will be
Okay.
their last chance.
This would be, okay.
I mean, there's no,
I didn't want us to set us up for like 5 years down the road, someone was asking to take it the 10th time or something.
No,
Okay,
this
cool.
is the
Good.
one last final thing, and it's
NAVLE,
an
yeah,
appeal.
one last time.
So yeah,
Oh,
So
5
that's
times.
that's a
and
NAVLE
then
rule.
One
6
time
and
as an appeal process.
Okay.
And if you
No,
fail
I'm
to
at-
pass
I'm
it after
asking.
the
Oh.
appeal process,
You're done.
you're done.
So the NAVLE rule is 5 times to pass. A 6th time can be, you can request to take the test as long as the request comes from the state, but then after that, you're done.
You're done.
And do we have any other information on this person as far as, I mean, there's no,
I'll just throw it to Josh, can you kind of fill us in, or, I mean, I don't know what all we can say, but my understanding is she's good.
can we see transcripts?
She's a Ross graduate.
Yes.
I mean, yeah, I mean, if she is,
Yeah, I mean, that's.
So like a
I mean, look, I know some brilliant people that have test stress anxiety. I mean, if she has A's all through vet school, it'd be a little different than if she had to repeat year 2, 3 different times.
Yes. Or is there a learning?
Well, now
disability that
typically, if
makes
you're a
it-
Ross graduate, then you have to
Different
go complete a
accommodation
year at
that
a
needs to happen.
US vet school.
It's the same distributor model
Right.
that we're gonna follow here. Sure.
I don't know. I wanna read this.
Potentially follow here. I'm trying, my brain is wanting to say that, you know, her transcripts look really good.
Okay.
And she is employed now, and she has a supervisor. And that's what she's doing now is
Tech work,
She's
that's
doing
all
tech
you
work.
can do,
Yeah,
direct
that's all
supervision, which is like.
Does she have to put in any documentation from like her employer on how well she's doing? Like, is she doing a good job in this capacity?
That's what I heard, because, Josh knows her.
Okay.
And there are all sorts of NAVLE preparatory programs. Is
Yeah.
she
Yeah.
doing anything like that to
I suppose.
advance
I
her?
suppose, I mean, we've had some discussions about test prep.
Right. This talked
Yeah.
about in this whole restricted license that they could get up to 3 restricted licenses.
Well, but she couldn't take the NAVLE again.
So I
Okay,
guess
so
like-
I guess they could have on,
Yeah, year
after
1,
times.
2,
3,
3
4, 5 or
to get you through.
Okay,
Do I need to not tell?
A lot of people are taking somebody's money from.
I wouldn't share her social security number.
Yeah, what was that
I
again?
need to know
The
that.
transcript. Basically is what they want, is your request. Transcripts.
Favorite color. But, yeah, if y'all can consider all professional aspects and want to.
I mean, I think that'd be
Or
important,
you don't
because-
have to at all. You
Yeah.
say, hey, we'll give her another chance, but it allows you to consider all sorts of factors.
I don't think I should read her grades out loud.
No.
It's totally fine.
I'll just pass it.
And where did that final year in the United States go? Like, where
Where did she go?
Florida,
She went to Florida.
She was a Florida fourth year,
things were good there?
as far as we know.
Hmm.
I have worked with this person
Mhm.
as a tech at, emergency clinic here. So I know her personally.
I've never been on shift
Never
with
been
her.
on with her.
No,
She normally works nights, so.
yeah.
Are we allowed to discuss any of that? I mean, it's a
It does go to.
One-
I mean. yeah.
wonderful person, hard worker. good-
Personal
I would-
attachment.
I literally
have used
don't know her.
As a tech, and I will sometimes, when she's working under me, I will let her run cases under my supervision. Me making all the decisions, obviously, but she seems pretty sound.
It's somebody you'd wanna call a colleague someday.
If I owned the clinic, yeah,
Cool.
I would hire her as that.
I think we're all trying to not have the case number 4 here, as a colleague, but everybody else, you know, I mean, they have the right to, if they
I would vouch
they
for
even
her.
wanna take the hard road, that's their choice, you know, I mean, that's a,
Well, and obviously
think if
vets
we-
have put in paperwork to vouch for her
you know,
so
The only
far.
thing we are missing on her file is transcripts from when she took it in Florida. There's 3 NAVLE scores that we don't have,
Why don't we
but she's
have those?
planning on providing them.
But she will provide those to complete
She
the
hopes
packet.
with-
And she's,
If she's done her
Working on-
application, why hasn't she done that?
I don't know that it's something that you have to
Oh.
provide per se. I don't know that it says,
I'm sorry, Kate, I spoke over you.
I was just saying that as long as we feel that we've done our due diligence in making that recommendation, so that doesn't come back in process.
We have a letter of recommendation from the supervising veterinarian.
It is forthcoming. Cause
yeah, she's
she's,
trying to find a veterinarian or veterinarians to be under.
So she doesn't have a
Not
restricted license yet.
not current.
Okay,
she has applied, correction.
got it, okay.
It was just kind of a new thing and we thought we'd want to bring it by the committee, let y'all know what
Sure.
some administrative functions we're doing for the first time.
So she's not licensed, she's working basically as a glorified technician. And then
Yes.
those veterinarians would potentially write her recommendation.
No, we write there's a form that we fill out. We appeal on
On behalf of,
of the student to allow them to set
Form
the
is actually
NAVLE.
to the International Council of Veterinary Assessment. It's the NAVLE retake form. This is what it looks like.
Which theoretically, the NAVLE could say no. Not even us.
Well, we're appealing on their behalf.
Yeah.
Yes.
So it goes before, I assume, some form of their, they make a
Archbishop.
decision on it.
So we need to get those letters, I guess, before we decide anything, no?
Yeah,
I
we,
think those veterinary attestments would be important to complete the packet.
I mean, the next NAVLE would be what, in the fall, so
Yes, they would.
we've got time.
Well, she's missed the window for the
The May one.
December
Okay,
testing window is already passed. It was, you had to have this done by
Okay.
June 3rd. So we're having to push it
Oh,
to the
wow.
next testing window.
but that also means that we have time if we want to ask for the rest of the record.
Right, and that was the reason for the restricted license is to allow her to practice under direct supervision of a veterinarian. Is her restriction.
The help of the restricted license is her to, it provides her maybe a little more income to be able to afford to take the NAVLE again and survive and all those things, because it's $700 every time you take it, plus study material.
Plus her loan debt.
We as practicing veterinarians sign our name to the work of everybody working underneath us every day. So, you know, if you're so all the way from the kennel worker, all the, go at the front desk,
Yep.
filling scripts, things like that, right?
Mhm.
So to me, if that veterinarian is comfortable signing, being the vet of record for the work this young lady does, then I think that I have no problem with
Sure, that's
making a
what I think,
recommendation at
that's
some point, you know,
Passed also.
if,
So we're not voting on whether we give her a restricted license day. That's not,
No,
no, we're just talking about,
This is giving you a heads
Yeah.
up that we're going to appeal on someone's behalf
Sure.
to set the NAVLE a sixth time.
yeah.
And then her application for restricted license would still come before this committee in the future.
Yes.
He makes that. The director of Arkansas Livestock and Poultry Commission.
so that's not for the board, that's just,
Okay.
May issue the restricted license.
and are we supposed to decide now whether we're granting her the sixth or the appeal?
So if every other veterinarian has to come before the board for approval, if they're applying to be an applicant in Arkansas, applying for reciprocity, then why wouldn't this have to come before the board?
She will come back around when she gets her final license.
No, I know, but for
As a
restricted, like,
Yeah.
why is it
Why
different?
does Patrick get to do it?
Yeah, why does Patrick get to do it?
Patrick's like, why does Patrick have to?
You know what he did? Before I even finished, the director or his designated.
That's right.
Designated.
Just because, I mean,
Cause that's a good point. Do you have any other restricted licenses out there in this?
So
Right.
this is comparable to a temporary license that we do all the time.
but
don't
we
affect-
authorize the temporary.
After the fact.
Ah,
We do it as an, because they've already got it in their hand.
yeah,
And we're coming back and says, hey, we issued this license. Hope you're good with it.
okay.
We processed, we checked all the boxes. And so.
That's all these we did today.
It's like we
Yeah.
did today. And then that's a formality that gets it into the minutes.
Okay,
Right. And then this restricted license, and we've told you what the restriction is gonna be. It's
sure.
direct supervision. Then I don't know if we will then remove that restriction or probably issue them a full licensure at that time. And then you'll get to see it again. You'll get to see the restricted license as well.
Yeah.
As it rolls around. And I think by timeline, you will, because she'll get the restricted. It's gonna be a while before she sets the NAVI again. And then you'll see her full licensure at that time.
Sure, that makes sense.
And there has been other restricted license granted in the past. I did find that,
Okay.
but it has happened before.
I just feel like it's something like we should, it just,
I understand where you're coming from, yeah.
it's a little below the radar. Only because we have to know about all the others. It's like, why is it not this? Am I making?
Yeah, it's below the radar because this is the first time it's happened. It's not been- I didn't know, you didn't even know that you get one, they even.
There was
Yeah, I
actually-
didn't realize this was like a
You
thing.
didn't
One
ask.
issued in July of 2023.
Oh, wow.
Restricted license.
But
But that was before us,
That
so
was
yeah.
the Kara era.
Blamer. I mean, my inclination is, she's got a lot of pressure. This is her last time she
Oh,
can take it
gosh.
through the NAVLE.
Yes.
Let her prove herself.
Oh, yeah.
I wouldn't think, I'm about to say,
Yeah.
I don't see any reason to not
Let's let-
give
I
her
don't
a
think it should
chance.
be a barrier to
Yeah,
that.
I mean, there's nothing showing that,
I mean, that's what we're being asked to approve here, is whether she's
Sure.
gonna take it or not, and I
Yeah.
say,
that's what
yeah,
I'm saying, are we supposed to
Go get
decide
it.
that now or after we see the letters?
Letters are only.
The letters are for the restricted license.
Okay.
This-
So for the appeal,
Yeah.
Be what-
They're separate things, I think we,
Okay.
myself included,
Yeah.
we're blending them
Yeah, that
together.
was.
I mean, the fact that she can't come back to ask to do it a seventh time. Yeah, let's let her do it the sixth
I would
time.
make a motion to, yeah, let her.
Yeah,
You wanna
and
make a
that's, I think this was
Yeah.
more informative for you guys that, hey, this is something new for us and we were learning that. And then
Yeah.
some of y'all that this is happening, well, I'm giving you a heads up because I think we would be culpable if we denied it.
The appeal,
Yeah. Because she has a right to an appeal.
we
You have
have
to
a
have-
right to appeal for her. So, or
Or
not,
not. And based on what we've heard about her, I think let's give her another shot.
Right.
And then, and it just so happened, one of those that we gave the license to, she had taken her sixth time from another state, so we had already been on our mind that, oh, that's a possibility, and then we get one of these and says, okay, how do we make that happen?
Yeah.
Well, and like Dr. Connor said, I mean, there's people that have trouble with testing that make fantastic veterinarians, so
Sure.
I wouldn't hold that against anybody, but.
So I'll move that we approve the appeal process for Shelby Lowry to take the Natalie for the sixth time.
I'll second that.
So we have a motion and a second from Dr. Williams and Dr. Plum to go forward on her behalf on the appeal process to take the Natalie for the sixth time. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
All opposed? Okay, item is
Wish her
done.
luck.
Yeah.
Mhm.
Okay, next item is TPLO surgery training. Dr. Niles, you want to give us an update on that?
Right, and that's basically what this is. This came to us earlier about what do we do with this, and I talked back to the individual. I said, tell me what you're doing again. And it's a licensed bona fide veterinarian that's coming into the state that's working with their corporate staff to do these TPLO surgeries, and they go into the surgery with them, and they're just there in an advisory standpoint. So I said, oh, you're just a consultant. And that's fully bona fide to come into the state of Arkansas and consult with another licensed veterinarian in the state
Without having licensure and all.
without having licensure in Arkansas.
That would be for any surgery.
I had a small epiphany on
They're
that one
not-
though.
They're not doing the surgery. They're just in there and they're the wing person.
They're teaching us to eat in wet lab.
Man, you know, I want to say this though, on that particular surgery, you're not touching that pet at all. If they get in and get in a little bit of, they get in over their head a little bit, or that's a fairly technical measurement, it's a fairly technical cut, it's a fairly technical. I mean, I have not yet trained a TPLO surgeon that I didn't touch that dog. Or that they didn't get partway through it and hit a cranial tibial artery and we had to show them how to, you know, or that they didn't, so. It's foreign to me to believe somewhere else.
They have,
And you're in there, no, I mean, the person doing the surgery on the dog, and you're in there just watching going, yeah, you're good enough to be one of us. I don't know how, if you're consulting, right?
no,
I mean, you've got to be scrubbed in my mind, and be there ready to help and jump in and fix a problem. Correct me if I'm wrong, but I mean, cause I was doing this exact role 2 weeks ago. And, for the third or fourth time, and in my own clinic with one of my own surgeons. And I was thinking, what scenario would I not intervene or, I mean, cause I can say, yeah, I like your cut and boy, that's good. And your measurements are true. And now be careful and watch out for this and watch out for that. But there's been, especially when they're learning, I mean, if you haven't had, I mean, I went to the Vitica Center and blew $8,000 and spent a solid week doing, lecture all morning and the surgeries all afternoon and all of that, came back home and, my very first one, I felt like I was spaying a cat for my first time ever as a, I mean, there's that little, oh heck level, and that's with going to the Vitica Center and doing it right, not the same. And so I guess that's where I'm a little confused. Cause if you're not scrubbing in and you're standing there just as an observer, then you're truly not touching that patient. You're not doing veterinary medicine in the state of Arkansas. But if you're in there scrubbed in, gloved in case there's a problem while they're going through the process and getting comfortable doing those surgeries, you're one of the surgeons.
And there's no proof that that's not gonna happen.
Well, I mean,
Yeah.
you could be doing it today without our blessing or our, so that's the other
Right.
part of the point. It's happening right now. I'm pretty sure. So,
my understanding, I left that part out, is they've already gone to a class with them.
Okay, they're just coming in and watching.
And then
them
they're
so they
coming
feel
in
Comfortable,
as support in their own clinic. So they've already been somewhere and done training.
okay,
But that
And this
person's
is-
already been somewhere and done training. Anything that we authorize here could have also more far-reaching ramifications. So if we authorize this, maybe the next person down the line didn't go to the class.
Who owns the animal? What's the scope of practice? Is this a training animal?
No,
Or
yeah,
is
wow,
this-
yeah,
This is
Client
a
animal,
customer,
right?
It's a
So you
customer.
have a client-owned animal, and that doctor on record is responsible for everything that happens, and they have a valid VCPR. So
But you
the other,
don't, you don't legally have to go to a training course to perform a TPLO.
No,
Right.
no.
You don't have
not at
to
all.
legally
Not at
for any
all.
surgery. I
Exactly.
mean, yeah,
But
so,
you-
Veterinary medicine.
yeah, right, I mean, do brain surgery, you know? I mean, you know what the hell you're doing, but, it's, you know, I think this probably, we ought to look at it broader. If a specialist comes in to my clinic to help me do an equine surgery, or your clinic to help do a TPLO or whatever, and that person's only here for a day or two as a traveling specialist, does that person need to have a permanent license in Arkansas, or can they work under the license of the person they're practicing with? This is happening all the
Oh,
time.
yeah, very
Again,
much
I mean,
so.
you know, there's specialists that come in and, you know, I guarantee you, they're not gonna ask permission, you know, to come into Arkansas or go in anywhere else and do these specialized surgeries. And I fly a guy in and he helps me do an arthroscopic surgery on a horse stifle. He's licensed in Texas, but not in Arkansas. He's there one day or half a day or whatever, and we do the surgery together. Does that person need to have a permanent license in Arkansas, or can you work under the license of the person you're flying in to work with? And again, this is, you know, this was somebody's question posed to you about TPLOs, but I think that's way too, that's the point of the needle. You know, I mean, what if you're doing a hip replacement? Does this rule apply for a hip replacement? So, you know, I mean, it's gotta be broader, in my opinion, that does a traveling specialist surgeon or traveling specialist, wouldn't even have to be a surgeon. That can they legally work under your license or my license or whoever?
There's a rule specific to that. It's in the exceptions of licensure.
Okay,
And that's a consultant working with a licensed
I
veterinarian.
mean, that, this would fall under that.
It falls
It
underneath.
sounds like there's nothing to
Right.
argue.
And it-
So I mean, again, this is a very
Well, that
pointed
was
question
my-
about, you know, we went to TPLO class together, but he's done 20 and I've done 5, so I wanna fly my buddy in from Iowa to help me do this. Is that legal?
Right.
You know, again, whether his gloves get bloody or not, and again, there's no way to regulate that.
No.
You know, is that in a consultant role? And if that is accepted as a consultant, then again, it needs to be broader than just, again, that we approve somebody to come help somebody else do a TPLO. You know,
Yeah, that was the biggest thing to me. It was like, well, that's literally a surgery. There's no way of, you know, if it was internal medicine and you're helping me hone my skills and we're both looking at data and we're looking at whether it be in real time or on a computer. But in that case, you're kind of in an operating theater and you're literally, I mean.
yeah, but an ultrasound would be the same way.
Yeah.
You know, I mean, you could fly, you know, radiologist in and line up 15 ultrasounds, you know, and it's not surgery. Was that person working under my license? You know,
It's a practice of veterinary medicine.
all right, these drug reps come in and do gastroscopy on horses. They come in and they scope 30 horses in one day, running gastroscopes down horses. Do they need to be licensed in Arkansas?
They're working on your license.
They're working
As a
with-
consultant.
I understand, right, that's what I'm saying, that
I've
If
traveled,
somebody's-
my previous
if
life,
somebody's doing
related
this
to life
surgery, it'd be the
travel for
exact
lots
same
of
thing,
things.
wouldn't it?
So this would be the same then.
This would be the same.
That's what I'm saying, I think it is, isn't it? I mean, is having a specialist come in and assist, whether they get bloody or not, okay to work under that person's license, or does that person have to go through the licensure process in Arkansas before doing it?
Consulting under your.
So there are no lines to draw then, really,
Right.
right? Okay.
And in the scope of practice, the attending veterinarian is the ultimate
It's
responsibility.
responsibility,
They're
right?
responsible for it.
Mhm.
Yep.
Yep.
True. Cool.
All right.
Okay. The next item is discussion around pulse electromagnetic field therapy, related Arkansas laws, committee opinion, attachment to packet.
You have a packet, there's a, I don't have a packet, this one doesn't have a packet.
It's in the letter.
Christabel,
No, that's the next
that's the
one.
next
That's the
one.
next one. Okay,
I don't think I have anything on this one.
all right, but a couple of
No.
people have,
I know that one.
the one case, this is on the docket, so I'm gonna go ahead and say it, the equine dentist announcement is also doing, pulse electromagnetic field therapy. And there's other people out there that want to do that, sort of like a TENS unit or something like that, so. What is that, the practice of veterinary medicine? Is it a therapy? And, if you go do a lit search on some of this stuff, they do call it, a therapy.
Well, it's a therapy, it's a therapeutic modality. Again, when you look at shockwave therapy, PMF, MagnaWave, cold laser, therapeutic ultrasound, red light. I mean, the list goes on about where do you draw the line of these modalities being veterinary only therapies or not? And, you know, I think last time we talked about that, I know like in other states, again, Texas, I keep bringing up, but it is much more defined as far as what a layperson can do versus a veterinarian. There are hundreds of people in Arkansas doing this pulse deal. Everybody's got one. You go to a barrel race and I mean, there's 5 people set up doing pulse pro on animals. And they're pulsing a leg or doing some sort of therapy modality on a low limb of a horse 5 minutes before they run in on a pattern, you know, and you got a 9-year-old girl on this and you're numbing essentially the lower suspensory apparatus on a horse and then going in at full bore. You know, I mean, the liability of that is huge, you know. That horse is numb and has a traumatic breakdown at the 3rd barrel and falls and kills the child. Whose
But
deal
you
is
have
that?
no liability or no, you know, there's no license to defend, there's no certification to have.
Oversight at all.
To me, it's
So different than
It's
pin
not
fire.
clear because that
Well,
any
therapeutic
different than
is
that.
tied
Pin
to a
fire.
treatment,
That's an old.
Yeah.
and the only one
Well,
that can,
In
make that
my mind,
diagnosis
it
is a
seems like
veterinarian.
you can go out and fix your neighbor's plumbing for no charge and be a pal and be a plumber or help with plumbing, but you can't really go out and charge to do, you know. So if you have to be a licensed,
Plumber or a licensed
Yeah.
electrician or
think
a
that's
how are
licensed.
you allowed to
charging.
go around and charge the public for things like this that are, like you say, many times potentially. And granted, fortunately in life, 99.9% of the things you do, you're not gonna cause harm. That's the first rule of medicine, is first do no harm. So how is it that these are, if they're doing it for free, or they're doing it to their buddy's horse, I don't think we have anything to talk about.
No.
But if you're doing it for a fee, as a professional or a
Or
whatever,
you're
a
marketing
certified
it
or
or-
training, yeah.
Sure, they got
They
tents,
totally
set-
are.
yeah,
Yeah.
I mean, that's
So,
all.
and
also-
the other one is, do we have the authority to police that or do anything about it? Because, quite frankly, I mean,
'cause they're
I see
charging.
3 in a row right here that said that very,
Dr. Moffitt's pulling it up, but in 17-101, 102, A, 11A. Practice of veterinary medicine means diagnosis, treatment, correction, change, relief, prevention of animal disease, deformity, defect, injury, or other physical or mental condition, including prescribing or administration of any prescription drug, medicine, biologic, apparatus, application, anesthetic, or other therapeutic or diagnostic substance or technique on any animal, including but not limited to acupuncture, dentistry, animal psychology, analytical chiropractic, on and on. It's right there.
You know, I think it just all boils down to how bad we want to fight this. And this is one thing I wanted to bring up today and whether we do this now or later. You know, we're either going to fish or cut bait on a lot of these stances that in my opinion, falls to us as whether we're going to allow this to continue or not. And then we've got to realize it doesn't end here.
no,
All right.
state law, wait.
The Senate Ag Committee and the Legislative Ag Committee and all that, they're under, and you know more about this than I do. They're under tremendous pressure from the Cattlemen's Association and Farm Bureau and all that to deregulate a lot of this stuff. And so do we really pick a fight that is gonna be difficult in Arkansas to do, in my opinion? And again, this affects my livelihood more than any of y'all in here.
Yeah.
And so, you know, again, I got more skin in the game. But I realize that, you know, you go trying to regulate all that stuff. And then all those constituents go to their representatives and their senators. And they're saying, you know, boy, these vets, you know, they're just trying to screw us again. I don't know if it isn't just going to be a hard fight to come out on top of. There are so many right now, the dentistry, which again, we passed the dentistry thing, but how do you, again, the age old question, how do you do a dental on a horse without sedative?
Right.
And again, xylozine's coming up here, you know, but I mean, how do you, medicine, I mean, how are these guys legally sedating these horses? You cannot do a dental on a horse without sedation. You cannot do it properly. Okay,
No, you can't.
you cannot.
Not with a
I've done
power
10
flow, you can't at all.
20,000 dentals. You cannot do a dental on a horse without sedation. And we were at the Capitol 15 years ago fighting this fight, you know, and we lost. There are so many of these things that have gotten pushed by because I get it. I understand what we're up against politically. But it's just whether we're gonna allow the 19-year-old girl in Batesville with maybe a high school education to float teeth using xylazine and amoxidam and advertise it on Facebook and do embryo transfer on horses and all of this, where any lay person in Arkansas could jump in and hang a shingle. And again, if we were plumbing a house or wiring a house, or if I was doing anything that requires licensing, to me, it just really, really cheapens our profession and it really makes.
Well, puts the public at risk.
Well,
It
the other
puts the
one
public
is,
at
how do you
risk.
draw the line between that and small animal dentistry and all, cause you know,
I
I
mean,
don't
there's
know.
people
You
running
can-
around doing.
You can
oh, wait,
sedate a
small
dog
animal
with
dentistry.
xylazine
Girl.
and you can clean its teeth.
Oh, yeah.
And you
Awake
can do that on
dentals
your
are
own
like
at home,
Which
but the
are
minute you
terrible.
charge a fee.
Yeah.
You're now,
Right.
so the problem I have is
Right.
personally that
I mean, the thing is, we've already seen this snowball. Like you said, equine dentistry, 15 years ago, this was a fight. And then now it's all these new modalities.
Oh,
And I feel like at
yeah.
some point we gotta put our foot down
You do.
and say, you know, this and future things that come up, like, we're done talking about it, like.
Well, the thing is, we have the
that's.
rule on the books, which is whether we
Enforce it.
And the whole purpose of this committee has been veterinarians regulating the practice of veterinary medicine.
Yeah.
You know, on a state.
Well, and I
level.
think, I think that some politicians think the board, our purpose is veterinarians regulating veterinarians. It's not veterinarians regulating veterinary medicine. Okay, and I guess, what is the role of this board? I'm confused, because is it veterinarians regulating veterinarians? Or do we have a say in non-veterinarians practicing veterinary medicine?
Well, after that, you're gonna be after it.
And you can go ahead. It takes
Yes.
a while to look things up.
I think both, for sure. I mean, some of this, I should have the authority in this situation to write a warning or even a consent order. The purpose of the committee really is to advise the regulatory authority, which is the commission.
Okay,
So that's what you're doing as professionals, is you're giving advice to a commission that doesn't have that technical aspect. So you're giving them that power, so to speak. And we've never really, the previous board has never really tackled those practices that were discussed today. It's always been complaint based.
right, that's the key on that. But it doesn't have to be complaint based.
I think
Well-
the folks in this room wanna take it
Sure.
to where we should.
Now, anyone can file a complaint. Members of this committee can file a complaint. You
Or
know,
bring a motion without a complaint, I think.
right. Yes, yeah. on the, Dr. Now, Dr. Moffett, myself, if we see something, we observe something, we can act on that without a notarized written complaint. So that's kind of why we brought this up today, is we want to know your opinion on this and how far we really do want to take this, because it's going to be a battle. Trust me. From all aspects. Because that is the battle that y'all been facing for the last 15 years, is those specific practices that are supported by others in the non-professional industry. And, what impact does it have on animal health in Arkansas? And that really is bottom line. Your role is to protect the practice itself, not necessarily veterinarians, but the practice itself in animal health.
Yeah.
Patrick, I wonder, is it possible to split the middle? And here's what I mean by that. Very first thing we said was, if you're Joe Blow, which in my community, I have exactly what Dr. Plone here is talking about. I've got a guy that works for the cable company. He's got an ultrasound, and he not only goes around and AIs horses, and now he does embryo work too, and he's branched off into pulling teeth and power floating teeth, and of course, he has he's doing all kinds of lameness type things with horses. I mean, he's not under the direction of a veterinarian. I have no idea where he's getting his xylazine and things to sedate him with. And I really feel like I don't even have the authority to ask, but he has nothing to lose. If he screws up and gets in trouble, you don't sue him. He doesn't have malpractice insurance. You don't threaten to pull his license. He doesn't have one. You have no authority over him if he screws up. You do every vet in this room, you certainly do, because you can threaten me with my accreditation, you can threaten me with my licensure, my DEA license, like there's any number of ways that I have to dot my I's and cross my T's. What I wonder is if you took every one of these people with these therapy modalities and you made them practice under the supervision of a vet, the VTSs, that's indirect, collaborative, whatever, you put a vet on the hook then. Then all you do then, if there's ever a problem, is you go to the head of the snake. You don't even have to know how long it is or what it weighs kind of thing. You go to it's the veterinarian that said it was okay. You run around there with my name on the line, my degree, my certifications, my everything else, and you go ahead and you numb that horse's legs and put that 9-year-old kid on it. Dr. Johnson, are you cool with that? Because you have a lot to lose.
Does that fall under the technician issues that we're having out there?
Well, the technician thing is
But they're not
Technologist.
a
charging
mile
fees.
wide. Well, you would have to have
These
some.
people don't have that.
Right, you'd have a bunch of
So
pissed
does
off
that put them
technicians.
under the umbrella of?
Well, in my thing, then fortunately, that veterinarian had better make sure, because I mean, you see, the public has recourse with veterinarians. They really don't have any recourse with these folks.
Well,
I mean, they can try to sue them.
I can sue them in civil court,
Right?
Because
Yeah, these,
But
it's
these,
civil matter.
the equine dentists that I've run across, I haven't researched all of these, but a lot of these folks are going to a dentistry school. There's one in Texas.
Nassology.
There's,
what is that?
so they're coming from a school and they've got credentials, and I said, well, didn't they tell you in the school what our law is here in Arkansas? You should research that. So there's and this is where we start compromising, give and take, because we've got to go out and marshal this thing. Who's gonna marshal that? We have some boots on the ground that could help us with this, but there should be a way that we can work on this rule or something. If you have to go to training, you have to pass that training, and we see that certificate. And that might be another special category for licensing. That if you're gonna do this, equine dentistry, and they're doing power dentistry, and they're pulling wolf teeth.
they're pulling molars.
Okay, so you're pulling teeth and they're getting the drugs, and what they're explaining to us is
Put it
that
on Facebook.
the owner of the animal gets the drugs from their veterinarian who has the veterinary license. And so there's the hook for a veterinarian. You went to school, let's see your credentials. How do we work that into our rules? I think it's gonna have to have some.
I think
action on it.
you make a veterinarian responsible for that and you don't worry about it. And the reason is, and you hang that vet if he does anything stupid.
And
And then
that
you see
vet,
how much that vet wants to A vet better be a little worried
would do
about.
due process on that, that here's this person that went out and got training
Mhm.
in doing these things in the mouth of that horse. And those things only, but it's out there, it's happening, and we're just not hearing a formal complaint yet.
We had, Patrick, in my town, we had a farrier got his hands on some, tranquilizer for sedating horses for farrier work or the power floating, or he passed it over to a lady who had, some cows, show cattle for the fair, didn't bother to take the time to break the calves properly. So she just basically squirted some in the mouth because someone had told her that was effective. Took essentially a half wild cow down to this county fair, kicked the kid in the face. You know, they airbacked that kid out of there, you know, in a coma and, survived thankfully. But it was because that cow couldn't have even been at the fair had it not been for the tranquilizer that the farrier gave that, you know, no vet in their right mind would have done that. And boy, talk about the liability and the, you know, so.
It's also really, what scares me is that it's very easy for someone to write down your name on a form. And then it becomes kind of a he said, she said.
But you know, again, back to that, I'm liable for, if one of my young dog walkers, if a dog gets loose from them and escapes, gets hit on the highway, I'm liable.
Yeah,
But
the owner
say-
ain't coming to talk to Sally, she's
Right.
coming to talk to you.
Yeah,
So-
but say, like, I'm out there, I'm, you know, doing whole laser therapy on somebody,
Right.
not a veterinarian, I'm not affiliated with the vet field. But I know there's a Dr. Pallone in town. He doesn't know me, he doesn't know I'm gonna sign his name. Like, there's someone talking about that, like, I was literally reading about it on Facebook the other day. Like, a CVT had written down a veterinarian's name and signature, saying that they were under their supervision for one of the at-home programs. And that was like, I never signed that.
Well, the
Like, well, I
beauty of
have your
that is-
signature right here.
The beauty of that would be, now we literally have something to educate. We now have something to police. No, you did that illegally. Right now, they don't
It's
even.
he
need them
said, she
to-
said, though.
So I know I'm oversimplifying this, but it seems to me that we have something, is that Practice Act?
Right there, number
That
seven.
we have
It is-
Practice Act.
Right.
It's,
We're all talking about seeing and witnessing this,
Mhm.
but have any of you filed a complaint to the
yes,
veterinary board?
yes.
Okay, cause I know
Yes.
we've been doing this for 6 or 9 months and I've not seen any. That's why I'm asking.
You
Right.
know, and as far as that goes, it's black and white.
Yeah.
There is a clear line
Yeah,
between practicing without a license. But when you get in the real world, some of those lines are very blurry.
Yeah,
Right.
it's,
So that.
Oh, well,
is kind
I'm
of
not
the-
practicing vet med, you know, the vet diagnosed this dog with lameness and the owner just came to me to do laser therapy on it.
For money.
for
But-
money,
but
that's a
that's
therapy,
where-
again.
For money.
Now,
seems like that's the cease and
Treatment.
desist type orders
Yeah,
that
that's
should go out.
If that
Cease and
was,
desist.
if that was on the order of a veterinarian,
Sure,
that makes it right.
Does it?
I'm gonna send you over here for, now, see that's on the order of a veterinarian,
Mhm.
and now if you send them to a bad laser person, I was trying to refrain from saying the J word, laser therapist, then that's on that doctor. But if it's on the order of a veterinarian, if you go look at the therapies on the order of a veterinarian for rehabilitation. And we have physical therapists in the state.
I think it was more like, say I diagnose a cruciate tear. The owner doesn't want to do surgery, you know, I talked about other options. But I've diagnosed that dog with a cruciate tear. And then they find someone who says, oh, I can laser your dog. That's been shown to help with cruciate tears. They didn't diagnose that cruciate tear. They're treating for it, but they didn't diagnose it because I diagnosed it in my notes.
Mhm.
I never referred them over there.
So
But
you didn't make the
That's-
connection.
so I never referred them, I didn't make the connection, but they are kind of squiggling through that little line of, well, I didn't diagnose it, Dr. Klein did. But I have, you know, this treatment modality that's been shown to be helpful. I'll do that for you for $50.
That would be practicing medicine without a license.
Oh, that's exactly.
It says
Is
do you
it?
enforce
Because
it,
I
or do you-
diagnosed it.
But they're doing the
No, she's doing the therapy.
therapy.
Right.
It
Either
is-
diagnosis or treatment or.
Yeah.
You didn't
the-
order that
It's-
treatment.
But
It's above
then,
and
but
beyond
then that
diagnosis.
goes back to treatment. Okay, so then, yeah, they need to cut all this out unless,
That's-
like you said, they're
Right.
with a vet.
Well, I'm
The problem, and I can tell you, the problem with what we fought is there's not been enough. Most of this is large animal, most of it. I mean, historically, most of this is gone, but first it's sort of the cattle and then the horses.
Sure.
When you talk to any politician, they say, my constituents say there's not enough vets out there to do the work. Rob and I have talked, I think that's not true, but in certain areas, that's probably right. What it boils down to is there's not enough veterinarians in my area that will do this for free
Yeah.
or
Yes.
for $8 or whatever.
Yes.
So the politicians are getting hammered by their constituents that there's not enough of us out there doing the work. It's too hard to get a vet, that we charge too much. Now we've got 2 schools coming into Arkansas, 450 licensed veterinarians. Now we're gonna be graduating 45 a trimester out of line, and then 100 out of, so I mean, we're gonna be tripling the population of veterinarians in 2 years, after they start graduating. It would be my wish before I die to have veterinary medicine in the hands of veterinarians in Arkansas. And this all boils down to, if you want to have your employee, like Dr. Connor said, if they work for Dr. Connor, if they work for me or whatever, and we have diagnosed a suspensory apparatus lesion in a horse, and we write a script saying this horse needs to have shockwave therapy every 2 weeks for 6 weeks, this cannot be done within 3 days of performance or competition. This horse needs to be rested for this period of time. This does temporarily numb this leg. You can cause traumatic breakdown. All that's in your notes. And that person, whether it's a CVT or a VTS or whatever, goes and does that. That person works for a veterinary company, a veterinarian licensed in Arkansas. Again, then that gets, the buck would come to me if something happened with that animal. All of these people that are doing this, 2/3 of them don't have a high school education. They go through a certification program that I sat through when I've got 4 of those PMF machines. It is literally about 15-20 minutes about how this machine heals from the inside out. It increases circulation, decreases inflammation, decreases cytokines, decreases prostaglandins. Oh, okay, hell, they don't understand every word you're saying.
Yeah.
Okay, sign you off. You've been certified. So then they go and are free to reign in Arkansas to do whatever, whenever they want to for money. And the problem is that as a board and as the previous board, and again, going back, this is when the cattle deal was going on, Ricky White. I'm not gonna get into specifics, but as a veterinarian, I tried to make a complaint. I was told a veterinarian cannot complain against another veterinarian or against a non-veterinarian. It has to be a member of the public that this person did work for that is making the complaint. I don't know if that's true or not, but we can get Kara and she'll remember our conversation, I promise. That is what the previous board and before all this was rearranged. And I'm sure there was political pressure on them to not go after some of these people. It is, again, I think it is very doable. I think what we would have to do as a commission, you as the board, would be to have conversations with the politicians. And they're willing to do that. I've been talking to a lot of them. They want some reason to believe that our profession is gonna step up and provide the services for them that their constituents are saying they don't have. And some of these aren't even constituents. Some of these are politicians that Rob Caldwell calls me. He's in Wynn. So on a Saturday, his horses get struck by lightning. He said, my insurance company requires a veterinarian sign off on this form within 12 hours of the exam. So Rob, I can't get to you, 3 hours away. I'm booked solid, So a lot of these guys have personal experience with the veterinarians not being able to serve their needs. The vet schools are gonna, again, saturate the area to a point where I think we're gonna have a whole nother realm of issues with that, but there'll be enough veterinarians out there to see every animal one-on-one before long. But if we as a profession could step up and talk to our politicians and assure them that we can handle this, and then take it to the next level and take the time to hire people and educate them to do the services, then it would get it out of the lay people's hands. The amount of this that's going on, again, and probably some in small animals
Oh,
too.
yeah.
But the amount of this that's going on in large animal is 10 times the amount that veterinarians do, probably more than that. There's so many of these, when you go to any of these events, there's so many of these non-veterinarians that are, again, doing dentistry and pulling teeth with sedation. And again, you can go on my guy's website right now, and there's pictures of molars he pulled today. You know, I mean, he goes on there and shows video of retropulse and molars surgically, you know? And so it's just, I think as the board and as the commission with the Senate Ag Committee and the House Ag Committee, and talk to them about not shooting us down if we go after these people. It's written, just like Sarah said, it's up there. I mean, we know the law and we know the rule, but I guess, correct me if I'm wrong. We've just been scared or tentative to go after these people because of the political ramifications, correct? And so.
Well, and the sheer volume.
Yeah, sure, yeah, I understand, right, and again, not having an enforcement team or whatever, I mean, again, you know, I text you that girl up there and, you know, and that just, it just gets under my, it just kills me to think that, again, somebody can come out without any training, any oversight, and start doing what we went to school for, what we,
Or what our technicians would.
what our, even our
do.
technicians,
I
that's
mean,
what I'm
to
saying,
me,
right?
We're taking a lot away from what technicians should be doing in your practice.
Sure. And again, that's what I'm saying. I think that, I promise you, I'll build 5 more clinics and hire 100 more people if we can get this in the hands of the veterinarians. And I'll put them out there and I'll police them.
Safely done.
Yes, and properly done, right, by the letter of the law. And again, I'll put stamp my brand on anything that anybody that works for me, and you would too, and anybody else that's in it. It's just that right now, and if I was a student and looking at the tuition for Lyon College right now, to put myself into that debt structure, to come out into Arkansas right now, to be able to do the same thing that I could do, not all of it, but a lot of it, if I never even went to and got my associate's degree at BB, well, that'd be a tough call. I don't see why more and more people don't just, shit, I'm just gonna skip that $300,000 in debt and just step right up and buy me a float and buy me some embryo transfer stuff and just start working. And that's the message we're sending. And I hear it from, again, you heard it from the people in Kansas City about Arkansas. You know, I mean, it's not just right around here. It is well known how lax we are. And again, I understand why we can't get traction. I've talked to the politicians. And I think that's where we have to start as a commission and as the board, and the veterinary board and this.
Just because it's hard doesn't mean it's still.
Exactly.
The
Right,
right thing to do.
right.
To go.
But,
There's a lot of good stuff that comes out of doing hard things.
yeah, most.
Yeah.
Yeah. You know better than I do as far as the hurdles we're up against. And, I mean, I would love your opinion on how you think that we could make a doable plan to alter this within the next 5 years.
Yeah, and I think let's just take the dental issue. In my mind, is that not a clearer cut case than maybe some of the therapy that's going on? I mean, that to me, you're talking about sedation, you're talking about surgery, essentially. To me, that is a very good clear cut case of or practice.
Practice veterinary.
Yeah.
How many of those would we need to bring before the board to make an example to?
Well,
get
first
some
of all,
traction?
Yeah.
we have a matrix. You know, one is a warning letter to notify them of their violation, and then to stop that practice.
Yep.
Then there's gonna be a fine, then they would be in here. And then that's when we would bring it to you all to look at. But we could start with that.
Okay, but then on the small animal side of it, you got folks that set up a wagon that have a, scaling and polishing unit, and they go around and they do awake dentals. And those dogs end up at my clinic, and the incisors look beautiful. The canines look beautiful, those front teeth. the molars are trash and all of them have to go. Because this dog has not had a real dental in 12 years. Until the breath smells so bad, the owner can't stand it anymore.
And we'll
So
see
there's-
that with, coming from groomers will often do a dental treatment.
Yeah, and
more
I've
skin
already
and
seen it.
polishing as well.
I've already had to have that conversation with the owners, go, well, you shelled out a bunch of animals to get your pet's teeth, or a bunch of money to get your pet's teeth brushed, really good.
Basically.
And like, so, but you know, they didn't sedate them, they didn't pull anything.
So is it-
It has to be a
Starting
starting
the letter. The letter.
Yeah.
To me, instead of tackling everything all at once, we take some of the more serious
Egregious
cases.
ones and.
We start there, we see how that plays out, and see what kind of kickback we give, and what kind of pressure, and then we just go from there. I think with this case, it's obvious, they're posting it on, we don't have any idea how many cases are really out there, or how many's doing that. But we start with this one case and we just go from there. I think that's the best.
Is that like a cease and desist? Walk us through that process.
Yeah, that's
So
exactly
a
what they.
complaint comes in, or how do you, what
Yeah.
triggers a cease and
Did
desist?
you pull that one up about?
Which-
On a cease and desist letter, will do one thing. It will eliminate them from putting it on Facebook.
Yeah.
You know, I mean,
You're notifying them
They'll go
that they are
underground.
practicing without a
Vaccines, and they get
license,
cease and
and they are in
desist.
violation of the state law.
That's,
So-
does that come from you or the
That would
commission
come-
or?
That would come from you.
Okay.
And then, you would give them a certain amount of time, and you would check up on them, and if they're still practicing, then that fine comes into play, and then it really gets elevated after that point.
Do we have in the commission workforce, do you have what you need to do?
Well,
that
again, we're going to take. it
Other states have, like,
basis.
enforcement
We don't have
groups.
to have them as they come in. We don't have a force that would go out there and check it for sure. So we would just have to do a complaint basis.
We have a complaint.
So who launches the complaint? The veterinarian or the public? Anybody?
Either-
Ideally, the public instead of the veterinarian, just so it stops that dynamic, but like I say, we
It's not
learned at ASVB or whatever, that we're members of the public too. So veterinarians can certainly
Absolutely.
lodge the
Yeah,
complaint.
and then if something went awry with that horse, then that's where a citizen would come in and make the complaint. And that's the way it's been acted before, but now it appears that any of us can be driving down the road and seeing somebody with a trailer pulling horses' teeth.
But your citizens aren't gonna make a complaint.
that's what I was about to say.
That's-
They're not gonna
For
make
the
the
last
complaint.
20 years,
Yeah.
that's happened.
You're
I
gonna
mean,
put
they're
the
getting
fire
a
in
service.
public.
They're, I was about to say, yeah. And the last thing they're gonna do,
Yeah.
yeah,
I mean, you might have some competitive complaints,
yes.
but you're not gonna get that. So that has to
Yeah,
be
just that.
escalated to the level of this
That also
committee.
means then our veterinary profession, our veterinary technician profession needs to say that this truly is a matter that's of public significance.
Yes.
And if you see it, say it. If you
Yeah.
see something, say
do
something. I mean, kind of those rules apply. It can't just be us around the table. I mean, I don't necessarily see some of the things you guys see, but you've got.
Well,
talk
and I
to
can
your
tell you
friends
that
and colleagues to say,
the
hey. we need to
history of the
speak up.
board, and I'm not, don't get me wrong here, I know this does great things. The history of the board in Arkansas, there's been inaction. And, again, I think that a lot of people did say something for a long time about several things, and there was complete inaction. And I know why. I mean, I get why. Again, when you've got that cattleman lobby and you've got that Farm Bureau lobby banging from the other side, they are, it's strong,
Yep.
right?
I wonder if we need to like you said, do the talking behind the scenes. Put out some sort of notice to DVMs to say, those that are practicing these practices need to be working with you as a subsidiary of you. If they are not, they need to be reported. Figure out a way to get the word out, to say, hey, we're letting vets know, like, hey, you who goes out and float teeth, you need to get in with a veterinarian before this date, otherwise there's a good chance you're gonna get brought up before the board. Not saying like this is a disciplinary thing, a very blanket statement to anybody who does those things. Put it up at the equine shows, put it up at the bovine shows. Hey, you guys got until this date, get with a veterinarian that you trust, that'll work with you. If they tell you no, guess what? You gotta stop. And kind of give a little bit of almost like a grace period to let everybody make things right. But then say, hey, after this date, we're enforcing it. Everybody, if you see it, you say it. We're gonna do something about it.
Second. PSA statement.
Yeah,
coming
basically.
from the commission.
Yeah. Yeah, nobody's in trouble unless you've been reported. But you got this grace period to get in right with the rules and regulations that are already written. If you're doing this under the direction of a veterinarian, you're gold.
Right.
If you're not, you need to get kosher.
I think we can start there. Yeah, I say the most kickback you're gonna get is of course gonna be from the public. Those customers, those clients, they're using, hey, you just stopped and one that's been.
No, but what you do is
For the last 10 years.
you've put them in that position where that person they've been using for 10 years needs to go talk to a veterinarian.
Yeah.
Now it's on
I mean,
that
it's-
person to make it right.
It's pretty cut and dry. I mean, there's no arguing that is. a
Yeah.
practice that-
So, and I realize I'm
Yeah.
naive because I don't have necessarily the history, but I think that the thing that comes about this is we need reassurances from you, Patrick, and Tanner, that somebody's gonna stand behind those statements.
Yeah.
That you're going to, there's gonna be follow through, there's gonna be action. We may lose it somewhere down the line, but we at least have to be a united front, because if there's any crack in that armor.
Yeah.
Then it's just
Great.
another.
Well, and we can work on
They're
that
safe. Nobody
politically
cares.
on the other
Exactly.
side of things. The Arkansas VMA actually is working together now,
Right.
trying to push an agenda of, we're not adversarial to farmers and to, we're not against the cattlemen, we're not against Farm Bureau, we're not against the public.
Yep.
We're here
And
to
that's,
help the public.
and
So we're working
ARBMA
hard on
has in the past not had a good
that. Right. We're
face with
working
the
to
Cattlemen's
correct-
Association or Farm Bureau
We're
at
trying
all.
to correct all of them
No, they-
in a short period of time.
but in the conversations
Yeah.
existing on the board
Right.
now with legislative team, I think we're getting in that
Yeah.
right direction. Thanks to you guys,
What?
We're all working at it.
but I think everybody.
Because, I mean, when I posed the question to a member of the Senate Ag Committee, what can we do about non-veterinarians practicing veterinary medicine? They said absolutely nothing. Nothing.
Well, the answer was kind of, you go after vets all day long and you take good care of those vets who aren't. But if it's a non-veterinarian, we don't have any desire to see you do that. So, but I think that fortunately there's enough gray here. There are enough little loose ends we can tie up. And by the way, I kind of realized what position that puts you in. Cause I mean,
Yeah.
you're that grain between the.
Yeah.
Big old,
Mhm.
and I don't think that's very fair to you either, that I think we need to give you the tools to help us.
Well,
So,
yeah,
we're
that's
trying.
another important role this committee's playing is a huge advisory committee as well.
Well, and hopefully, I'm sorry, go
No,
ahead.
go ahead.
I was gonna say, hopefully the commission will notice that if we do pursue this, that they need to be with a veterinarian. We're not putting the kibosh on this. We're redirecting and we're kind of adding a legitimacy factor to it. So the onus is on the person who's doing these therapies. And if they haven't, then that's on them. But those that have are now more legitimate, more directed. The way I see it is we are actually like enhancing the veterinary care using the resources that are already out there. And maybe that can make it a little bit more palatable. We're not taking it away.
No, but you may actually have to pay.
You might actually have to pay for it. And there may actually be veterinarians who say, nope, I know this guy for 10 years. He's terrible. I'm not gonna work with him. That might happen too. But why is he terrible? Because he's sending in a bunch of lame horses or something. So, if we can kind of put the spin on it as we're trying to make veterinary practice better in Arkansas by legitimizing the services that deserve to be legitimized and still provide that access to clients, maybe it'll be more palatable.
And adding to that as veterinarians, one of our jobs is to protect public,
We're
Absolutely.
begging to help protect the public from
and this is
some of our
absolutely.
Couple veterinarians who aren't
That's a
Yeah.
hat that,
doing, hold that
that
up.
you wear and you raise your hand and you take an oath and that's part of
I
protecting.
mean, we could very easily put the
protecting your
kibosh on it and say,
profession
nobody can do this. I'm
and
sorry,
protecting Public.
you're acting like a vet. To protect the public,
Mhm.
but we're not. We're trying to look for a compromise.
Well, more to come on this for sure.
Thank you.
Thank you, Patrick.
Appreciate your
Yeah,
Thank you,
thank
Mike.
you.
Mhm.
patience and your,
Do we, we have a complaint, and everybody seems to agree that this person is practicing without license. Do you want the director to write a letter to them? Where do we go from?
Well, I don't know the legal, I mean, yeah, a cease and desist letter obviously would be the place to start. And I can tell you, again, I don't know if you were here with Doug Fry and I mean, I can name you 20 guys that have gotten these cease and desist letters and they just stop going on social media. You know, I mean, it doesn't stop anything. They just stop advertising on social media. Obviously, you got to start somewhere. So, I mean, you do the cease and desist letter and then if they don't cease and desist, then it gives us more traction to, but and I completely understand the lack of manpower to go out and police this, you know, are you gonna go, Rick Beavers? Again, you go on Rick Beavers' website or his Facebook page right now, and there's pictures of all these molars and stuff, he posts them every single day about all the teeth he pulls, you know, and the horse is laying there under heavy sedation, you know. So, I mean, he's, I don't think he's even done the certification thing through the state, you know. So he's advertising dentistry, send him a cease and desist letter, and he quits putting it on Facebook. Well, then 30 days later, does somebody police that? I mean, I don't know. I'm asking, I don't know how you would make sure that he's stopping doing it, because I can tell you the public is at a mindset to where they would just about rather. Rick charges more than I do. Rick charges more than I do to extract molars or do the general dentistry stuff. His prices are higher than mine. More people use him because he's just a dentist and he's, you know, there is a mindset here to where, again, a lot of times they just don't want to use a vet. And so it isn't that he's that cheap, because he's not. So we send a cease and desist letter and they continue practice. Then there's a monetary fine after that. And after that, it's kind of like shooting a deer out of season. I can go to Colorado and shoot a deer out of season. It cost me $1,500. The hunt would have cost me $3,500. What's the downside? You know, these guys continue to practice and they get $1,000 fine or whatever it is. I don't know. I'm not telling you how to do it because I don't know. I'm asking, what can we do?
The second step is a consent or an agreement.
Okay,
And in that is a set of parameters that you have to follow. In y'all's case, continue education.
Yeah.
Records.
right.
Monetary fine. In this case, you would set those parameters on what they have to agree to. They can either agree to it or not agree to it.
Okay,
If they don't agree to it, then there's a public hearing.
okay,
If they agree to it, then they stop that practice and they pay their fines. And then after that, if they continue, then it also goes to a public hearing. That hearing is gonna be set before the commission. The commission will set that
That
determination. Whether it
punishment,
be
whatever.
fines up to $5,000 per instance.
Okay,
So then it would be his opportunity to come in and plead his case. It would be a court type setting. He'd have witnesses, we would have witnesses, and then, the commission would make their final ruling.
So you're saying it takes 4 reported incidences?
No, it could be one reported incident.
It just has to rise to the level of probable cause before Patrick would do the citation.
Okay, gotcha.
Yeah.
17-101-14.
Completion of the investigation.
Because this says he's a certified equine dentist.
You
So
investigate.
most lay people would read that and believe that he's like credentialed and.
Sure.
knows what he's doing.
sure. And look, he does.
He's got more specialty than
Yeah, sure, he's a
Dr.
dentist.
Plum.
Yeah.
I mean,
Yeah.
we hear that all the time, don't
So
we?
he's like a human dentist?
No, he's an equine
He's
dentist.
an equine dentist.
Right.
But he's not acknowledged.
he's not a dentist or a
I
veterinarian.
promise you, he probably has a certificate from the Institute of Nathology.
Yes, and,
In Montana,
you know,
which is like a 3-day online school, and if you pay your $3,500, it comes with a a power float as well as, you know, a mouth speculum to get you started.
And
You know,
a
kid you
headlight,
not.
right, headlight.
Yeah, and a headlight
And
and
dome
a
light on.
certificate that says you're,
I'm gonna have to find
Now,
his page. 'cause-
so anyway, it's quite
Right
interesting.
there.
And you know, and I don't know, I don't really know where we fall under that too, that, I mean, the idea that someone is issuing a certificate of equine dentistry from the Institute of Nathology in Montana. Do we have, who has the right to even recognize or not recognize that? Because if you get that online certificate, you're now allowed, or you do at least run around the state of Arkansas and advertise your services as an equine dentist.
Well,
Now you're an equine
our
dentist.
authority is to issue
So,
certificates or licenses for technicians, and veterinarians.
cool. And if you don't fit in that,
We have no authority to issue any other license.
but I mean, we can say.
But
we
it's
don't
not prohibited to
recognize
do.
that, Right?
Yeah.
There's nothing that says you can't do it.
Equine dentistry, I
Right.
mean, it's,
And that's
But
almost
yeah.
what we need,
Right.
is to say that you
Right.
can't do that.
well,
Well, I'm
we
saying
lost
there's
that
nothing
deal.
We-
There's
yeah.
nothing to say you can't have a
Right.
license, but
Well-
yes, there is something to say you can't practice without.
Can't practice medicine.
Well, I think that's something for us, when we talk to those lawmakers and they say, give me something specific
Well,
to act on.
yeah.
I think we now.
Well,
have-
by-
And again, I'm bringing up Ricky White. They passed the law where, you know, embryo transfer and pregnancy diagnosis of those cattle is how the law was supposed to be written. Then they changed it. In bovine. Well, then they stretched that to where it's just pregnancy diagnosis, and now they're working on all the sale barns, pregnancy diagnosis. Doesn't have anything to do with the cattle they embryo transfer like the law meant, but they're doing pregnancy diagnosis. That's fine. Well, then they start semen checking bulls and trick testing bulls. That's when I got involved. Rick Beavers, again, he could be a dentist in Arkansas if he didn't sedate and if he didn't pull teeth. I mean, those are the two things that it says in there. I mean, extraction and sedation. So it isn't like we're saying, look, you can't do your deal. You can do it. If you can do it unsedated and you don't
Trim
pull
their teeth
teeth,
like you trim their feet.
right, you know. But again, they
Hand float them and.
they get just one of these laws, and again, if y'all read that, where that meeting in 2013, it's hell, 22 years ago. It states that what for that year, y'all were you even in then, do you remember?
Mhm.
It was that year that was, you know, you couldn't police anything for it. It was going, there was a moratorium or whatever on it. And then after that, then it was all great, right? There's no law, right? It's just a rule now.
It's a rule, man.
It-
But, you know, it's.
No, it's in the practice
It's a
act.
practice act.
It's in the practice
Right
act.
there's a practice act.
17-101 through 315, that's the law.
And all you can do is float the teeth.
Right, but after July 1, 2013.
You're asking, does that same terminology apply now as it did then?
Right, so the Arkansas Livestock and Poultry Commission is prohibited from enforcing commission policy regarding equine teeth floating by either investigating or prosecuting an individual practitioner engaged in equine teeth floating until July 1, 2013. That was that period where it was,
Moratorium.
right. So then, but after
After
that,
that,
what does it say?
It says all you can do is float teeth.
13.
Yeah, it's fair game now.
All you can
so
do
all
is
they can
float
do is
teeth.
float teeth.
That's
Okay.
right.
And I tell them when they call, how do I do equine dentistry in Arkansas? I said, you don't. I said, you can float teeth in Arkansas and that's it. Cause we get all the calls. And they usually will toss them to me or Dr. Moffett. We'll handle anything veterinary medicine related to practice supplies. But that all you can do is float the teeth, period. And it doesn't say that you can knock them out to float the teeth, but they're getting the drugs somehow, somehow.
Mhm.
But right now, at the Practice Act stands, there is no equine dentistry in Arkansas. You may float the teeth and trim their hooves. That's it.
Or be a veterinarian.
Or be a veterinarian.
Veterinary technician.
But it's all well and good to have that in writing if it's never being enforced.
Well, and it's not being enforced because the first look at Facebook, there were 5 people that popped up advertising themselves as equine dentists and holding teeth in their
Yeah.
hands. I could almost allow them to wolf teeth. I get
Exactly,
popping- I
exactly.
Popping out wolf teeth. I get it.
Yeah,
But now the molars,
right.
So,
Incisors, you know, all these guys that pulling all these incisors for the autoimmune deal, you know, I mean, that's gotten huge, you know, and they make a fortune, charging $4,000, you know, to pull all the incisors. How are they diagnosing that that horse has autoimmune, issues in their teeth? They don't, they can't.
I think we have a statute that gives us the ability to take action on that. So I'm kind of scrambling here maybe to push things forward a little bit, but not.
Well, I know we've gotten well, of course, I
Trigger.
apologize, it just, that,
Trigger is a.
I mean, not
complaint
really, cause our
or-
next,
No, I
like,
think-
I
three
think you're-
things that we need to talk
you're
about fall under that
spot on,
umbrella.
actually. Yeah,
Yeah.
Yeah,
It just has to rise to the level of probable cause.
So now the trigger is complaint.
Now, if somebody was doing it right in front of our front door,
Yeah.
you know, we wouldn't have to have a complaint. That's probable.
that's what I was about to say, if you see it on Facebook, you shouldn't need
You
a
can just go to
complaint.
this
Right.
fairground.
But look, you look at
Right.
it, and just because they got a handful of teeth, doesn't mean they pull them. I mean, that's something that we have to investigate and we have to look into, and there has to be probable cause, yes, in that probable cause.
you gotta wait
we've
for the
been
video of them doing it.
I know
Now we
that.
gotta find out if they're actually doing it, and we can do that through witnesses, testimonies, and things like that. But your probable cause would be the Facebook online, you're admitting that you're doing it, so let's get it.
Yeah, cause it does say after an investigation and, you know, who's gonna do that investigation?
And that's why I said there's more to come. We need to look into it a little bit further,
Since,
get the proof, get the evidence so that I can have something to stand on.
Well, I guess the moral of my whole rant was that if we're gonna take a bite out of a whale, I mean, we need to be hungry enough to eat the whole thing. If we're going after one tooth floater, then are we gonna make a stance on all the 7,000 PMFers? Or again, it's just, if you go up, it's still in the Practice Act. I mean, that's a therapy apparatus. There's no doubt that that's considered therapy and it's, you know, so if we're gonna take on one, are we gonna take on all of them or try to, or is that something that, again,
to me, in my mind, I see this as, it's like speeding. There's a law.
I was just
and it's
thinking about that.
well-defined, right? And we do hear there's Operation Safe Speed, and boy, this weekend, they're gonna be, you know, they're gonna take it more seriously in some states, some counties. I think, well, it's already on the thing, if they say, well, this committee is going to take that more seriously and gonna take action on the laws that are already existing and on the book. And we're proving that we will, because we already sent a couple cease and desist letters out. It puts everybody else on notice that, hey, you know, I might need to be thinking
How
about
long,
And-
how long do you think it would take with one warning letter on social media for that to
it
get out?
completely.
Yep.
I agree.
And I think penalties need to be grand enough that it's deterrent. You know, if someone
Yeah.
says, well, I can make that back with like 5 more animals, that's not a deterrent.
Or even one.
You know, if they're facing a $10,000 fine for the first provable offense.
What's a speeding ticket versus a DUI? You know, I mean, it's, one is,
Yeah,
well, I need to be more careful and look out for
Yeah.
police and not have as much of lead foot. The other one is, well, I better not ever do this again. Right,
And those-
so.
and the fact that the police can give you a speeding ticket without even being there, because they got you on camera in a lot of
those
states.
suck.
They suck, but if you're stupid enough to post a video of yourself extracting molars on Facebook, there's your video
Yeah.
proof.
Then who determines the fees? The fines would be from,
It would be the order of the commission. Now, the first one, generally, it's usually like half of the fine, we just kind of determine that on the very first case.
It's capped at $5,000.
But yeah, it's no more
For a
than
fee.
5,000.
no more, perfect.
This fall under unlawful practice, any person who shall practice or demonstrate failure methods without having, then it gives you specifics on each.
I'm looking around here as the one that gives us the power to enforce it in 314, practicing without a license. And it details more specifically practicing without a license. you may be able to derive something from there.
One thing too is education. I mean, nobody that does the PMF, nobody that does the cold laser, nobody that does the pulse or the shockwave think they're doing anything wrong. They really, I mean, they come up and talk to me about it all the time, you know, and again, they're set up. You go to Texarkana or you go to wherever these barrel races are, and they're set up right there in broad view. It's not like they're hiding in the stalls. You know, again, there probably needs to be a conversation that, hey, you know, I had a girl that bought one of these cryo units, so and that's big in equine deal, and it's, you know, it's super cold treatment of an area for anti-inflammatory, very effective for analgesia. Again, not very safe to, you know, when you look at the racing commission, and that's something that, you know, would be a decent guideline to go by. When you look at the US Racing Commission guidelines on therapy modalities before a race, those things were put there for a reason, you know, to where they don't have traumatic breakdown because this horse is numb, because that's what most of these modalities do, you know, it's temporary analgesia. And again, so when they're all set up at all these barrel races and all that, this girl called me, it was a $50,000 cryo unit. Is this, she knows on the board. She said, is this okay for me to do, you know, and go to barrel races to do? I was like, I don't know. I don't think so, but I don't know. And so a lot of people aren't doing it maliciously, you know. And again, Rick Beavers, you know, I promise you that he thinks it's fine. I guarantee he does. There's no way that he would put that out on his, I mean, every day you follow him on Facebook. And all the people that work for me, you know, come up and show me. And I mean, every single day he's putting this stuff on Facebook. You know, there probably needs to be, I'm not saying to find this guy the first time. I think we call him and say, hey, look, you know, we just want you to know that, you know, what you're doing on the molar extraction, you can float teeth all day long. If you've got a relationship good enough with your vet and the vet's gonna give you carte blanche on the sedative, I guess, I mean, legally, he can't sedate, even if he gets the drug, right?
Well, that's my thing. The
Right, I
vet's
mean-
now on the hook. And the vet, you can enforce what the vet does to a much higher level. I wouldn't allow, if Mr. Beavers were very proficient, he was my employee, he could do that in my barn.
In clinic, right?
with Me, then it becomes direct supervision, then if
If
there's a
anything went
problem.
wrong, you're
Right
there.
there on the, you know. and then
I'd be happy if it was even indirect supervision, as long as the veterinarian was, again, at somewhere,
Insurance, my license,
that
somebody that
liability.
has oversight of it.
Right. The public's more protected, actually.
Mhm.
They don't realize that, but I think it is just a mindset change and it's gonna be, there's gonna be a little bit of public education will have to go with that. Because you do it wrong and all you've done is you've made vets or jerks and they're trying to stick it to you and they're preventing you from getting.
And that's
a better
the,
Well,
what
you have that.
ACA, Arkansas Cattlemen Association, Farm Bureau, I mean, that's their push on this, is that, yeah, that the AVMA is just out to, you know, get it to where vets only can do this, they can charge exorbitant fees. I mean, they're pushing hard on that other lobby. The law on the pregnancy diagnosis doesn't apply to horses at all right now, does it?
The embryo transfer.
Pregnancy diagnosis?
That is bovine only.
Right.
There's,
So again, this girl that's doing this and the guy by you, and again, Doug Fry did it for years, but
she indicated that she's just doing it on her horses now. The embryo transfer, she said she's learned how to do that, but she's not advertising she's gonna do that, but she has learned how to do it.
I'll send you an ad.
You guys are
Unless
spoken.
there's new updates on the
Mhm.
Facebook, but
It
looking
may
at that.
still fall under the broad definition of practice of veterinary medicine.
But it goes back to.
But again, that bovine law, what year was that?
The embryo transfer.
15 or whatever.
Yeah. And you have
Yeah.
to read into it to find out it's bovine only.
But it does say that.
It says the word bovine twice in it. And it does, specify that you can preg check the animals that you transfer.
All right. Well, then that got blown over immediately because 75% of sale barns in Arkansas are using lay people to pregnancy diagnose. And write health papers.
Stop it.
That's true.
When I took over a sale barn years ago, I opened the desk drawer that I had and there were all of these signed health papers in there.
Oh, piles
From
of
the veterinarians before me, they already pre-signed
Oh,
a bunch of.
Oh, yeah,
So
yeah.
we're not,
I give you a little
We-
bit of anxiety.
oh, yeah, well, and
We don't
so
always do
vets have a lot of
ourselves,
veterinary
Yeah, right.
fix, and I'm totally cool with that.
Yep.
As part of that is a big part of our job, and hold each other accountable.
Mhm.
But the fortunate thing was, at least when I called them, go, you know how much trouble you could be in for this? And you know, you can get your accreditation pulled and your whatever. And, wow, that was actually a legit threat. Y'all, you shouldn't be doing this. And, so it feels good to be able to say, you know, this is out of line. Don't cross it, you know, so I think we'll be all right. We just have to be tactful and tactical.
You know, you're writing a CBI on the lower cows while you're in office.
Yeah.
100%.
Just to keep clear direction on this, as
Mhm.
far as the therapies go,
Um,
I'm hearing that we want to send out a notice, perhaps a position paper from the committee that these are considered practice of veterinary medicine.
Yeah.
Yeah, I don't
Yes.
see how they couldn't be, yeah.
Mhm.
sounds reasonable.
I think that's a great way. Do you need a motion on that?
Sure.
Is there a motion?
Repeat what you just said. I like the way
A
you
position
word.
Yeah.
paper.
The
Uh,
position paper.
Position paper that they are practicing veterinary medicine.
you said something about position.
That the ARVMA can share on their Facebook and Instagram, then we can all share Facebooks and Instagrams and.
I would
What do you
say,
wanna
I would
call
say,
it?
I mean,
A clarification,
nobody has to consider anything. It falls underneath the definition. And we could say that.
and just put a notice out into certain fields. I can reply back to the people that ask about it, that we reviewed it. The committee says, this is practice without a license.
Like it.
Well, unless under the direction of a veterinarian. So, okay, we'll frame that and let.
The
Yeah,
committee
and
is
the
adhering
final
to
thing-
previously set standards and
Direct,
clarifying.
indirect, or collaborative.
Practice Act and the law.
What is the word that goes in that? Under the supervision of a veterinarian, under the direct?
Under the
Indirect.
direction.
Okay.
I would let them,
We'll issue a
Is there-
statement on
I would let them do that. I don't
Let
think
it
we
be?
need to say that in our
Okay.
motion per se.
Mhm.
Just
Okay.
charge them with the position paper and then let Tanner and Dr. Niles work out the legal wording of what needs to be said. in it.
I'm landing on, a committee opinion.
Okay.
Committee opinion?
I think.
I don't
It is
think it's a
position is
committee
stronger.
opinion. I think
It's
it's
our
the,
opinion.
And it's a
it's the
recommend.
Yeah,
law.
that is actually true.
Yeah.
It's not our opinion that that's the practice act.
Yeah, it's the Practice
It
Act
is under
states.
the.
I don't.
Oh, committee
It's-
reiteration.
Practice Act state.
The committee itself is, I mean, we can.
Committed to upholding the practice act.
Yeah.
Y'all can support it, but it's to make recommendations on these sorts of issues to the commission.
Yeah.
And, you know, it doesn't say anything that you can't do, but, that kind of, that is inclusive. What y'all are supposed to do. So y'all can say, hey,
We should-
thumbs up on the commission's position to
Uphold the practice.
uphold the practice act.
And our language should be as strong as possible on
Okay.
that.
That makes a person.
Okay, we'll frame something for y'all to look at. And then do we need a motion?
Tanner, do we need a motion on that?
Because we're writing about something that already has.
Or it has,
If y'all wanna make a motion to approve or to recommend some sort of statement to the commission, y'all can do that. That's more, y'all have the freedom to. This isn't really an action item itself. We can do it for the commission ourselves. And if y'all say, hey, we got y'all back.
It'll be in the minutes.
okay.
That we
Right.
encourage that.
Yes.
So do we also need to, so that, obviously, we just have been technically on pulse electrofield, magnetic field therapy. I think we've covered equine dentistry, cold laser therapy.
Same.
They
I
could
think
fall under.
that falls under that.
Any
So is there
any
additional-
any rehabilitative therapies,
Mhm.
because there's some dialogue out there that we could
I think we
pull.
go back to the practice act
Also,
and reiterate the things. in the practice act.
Massage chiropractic?
Now, massage and
Chiropractors,
chiropractic
that's already
is
been
a
addressed.
doable thing.
It's been addressed? Okay.
It's been addressed.
It's been
A human chiropractor can get an animal add-on to do it, and that's it.
That way, yeah, or veterinarian.
Or a veterinarian. can
Veterinarian,
add
but
on.
veterinarian has to get certified in chiropractic too,
Okay.
yeah. But in Arkansas, you gotta be a certified animal chiropractor, which is either you gotta start as a human chiropractor or a vet.
I was just thinking about the one that we tabled about
Now,
animal massage.
Massage, I think it's fair game.
Yeah, I don't think there's any regulation, massages.
Really, you're not making any medical claims on a massage.
Yeah.
And you
And-
feel better.
And massage therapists can't move bones. If you're moving bones, you're a chiropractor.
Fair point.
What action is needed on equine dentistry? Are we writing, is the director writing a letter?
I think that falls under the position paper that you just talked about.
Yep.
I authorized the boss of this to do this.
I think that was mainly to get the opinion of the community on how we should go further from this point. And I think we got that.
Okay.
Is there anything else that you need on the Christabel Carpenter? To me, that falls squarely within the discussion we just had around cold laser therapy.
Yes,
Okay.
I think we're cool.
The next item up for business is, at least I think, correct me if I'm wrong, is CE extension for Dr. Carnahan.
Yes,
Yeah, what's the situation with that?
okay.
Please give us.
This year, we have Dr. Carnahan's application for his renewal. And first of all, he does not have adequate CE for this year.
For this previous year.
For this previous year, he does not have enough CE hours
So did
to
he
work
get his
on.
license renewed?
We gave him an extension.
Okay.
I gave him an extension because I'm not gonna say we yet. Maybe in a couple of months, we'll say we. Me and him, we bounce it around, me and him. I hate to say me, but
What was,
because he turned in for 8 hours of visitation with a colleague, another 8 hours for visitation with a colleague, so 17 hours with
No.
visitation of colleague.
Isn't it pretty clear? It's like, what, 2?
Yes, ma'am.
That's all that's allowed?
Yes, so,
But
so I got on the phone to talk to him about it, you know, and what's the deal? And I said, what's going on here? And it reflects back to a, 2021 waiver and extension that he's been working on ever since.
So
no,
what did he do in 2022 and 2023?
That is not documented.
who is he?
Dr. Carnahan is a practitioner that only does spays and neuters 2 days a week. And I says, well, this is not gonna work. Your extension was only back in 2021. You don't have enough CE credits. So I can administratively give you an extension to get your CE requirements.
Go
For this
online
year's
anytime,
renewal.
yeah.
yeah,
So you're not denying.
there's
Yeah.
no
Yeah.
any
To live
CE
by those
opportunities.
It was granted back in 21 based on medical conditions. He just can't get to the meetings and can't do that.
Online,
And so I said, well, and I was going, well, we can give you waivers, we can give you extensions, we can give you more on stuff, we can accommodate you getting your CE hours, but we can't give you a full license like that. And I said, we could even talk to you about a restricted license, that we can restrict your license to just do spays and neuters at this animal shelter or wherever you're working. Well, you know, there might be one with an eye that comes in and I gotta work on that curiosity. So I know you're not just doing spays or neuters.
but the thing is, in 2021, that was a height of COVID, where everything was online.
Well, if you can go visit
Everything.
with a colleague at the practice of the colleague for 8 hours times 2,
You can
you're
probably
getting
get
out of,
from
you're
me.
getting out of the house.
Yeah, so.
Yeah.
So
And I know
Yeah.
you've gotta have 10 hours that are
But that doesn't
live,
have to be live.
but there's,
But it sounds like.
you can do live
Get on the
webinars.
computer.
under the same
Is it
accountability as
the fact
us.
that he doesn't wanna get on the computer or
Right.
something?
Not that
You
it's
can't-
relevant, but how old is
you-
Dr.
you
Cameron?
can't-
If you're too old to get on a
Take-
computer to watch a CE, you're too
Watch
old
it
to
off the
spend
internet.
minutes.
I was trying to scramble for his license.
I don't mean old,
I
I
can
mean
find
like
someone.
infirm. If you're too infirm
Yeah.
to get on the computer.
He's less than a year.
If he's, oh, the goodness, there's a grandkid or somebody that can log
So,
in.
and here was his.
Yes.
Here was his ask. Dear board, a few years ago, I sent a petition letter to,
Kara?
board asking for a reduction for my CE requirements. As stated, multiple problems, going to the meetings was hard to get to. You said that time I could get by with 10 hours of visitation only. I assume that is still in effect, sincerely, and so that was his request.
Do we
For-
have proof of that from our end, granting that request?
Yes,
Okay.
back in 21.
In the
Oh, yeah,
middle.
yeah,
Kara
sure.
did, or the board or somebody
Back in
did.
21, and
Okay.
then I tried to do an audit of what he has done in between that.
Yeah.
I have it right here if you want to know.
All the rest of those?
And I mean, check the years. This was.
Dr.
signed-
Moffett, make Dr. Niles feel better, say we have
We have.
information.
It's an L track, when I looked, it didn't come up.
The royal we.
In 23, he signed at 3/30/23. He did 80 total hours. 49 of those hours were visitation with colleagues. 42 of those hours were a bunch of different classes. Most of them were in relation to fees.
It works.
I was gonna say, I've talked to a few of those.
So there's 20, you got his 23.
Alright.
Yeah, so he did 42 total hours of real, actual CE.
In
And then
23.
29 hours of visitation, and that was in 23, and then in 20,
So he obviously didn't think
He
his
can.
whole 10-hour
He can.
thing was still in.
What about 22?
and this is, this one's signed twice. One date is signed 3/26/21. The next time he signed it was on 3/31/22. Not sure why, I think he just
Maybe he had to amend it.
copied it, I don't know. He did 25 total hours, and they were all in visitation.
But our CE requirements are quite clear from what you
Yes,
can
yeah.
accept, so his Bs,
Oh, yeah.
maybe 4 would truly count.
Well, if he did 20 some, I mean,
I
that,
get to count on mine.
So in 21 or 2, not sure which one.
we're not auditing our own process very well.
Yeah.
It's dated by Kara Stamp as April 4th, 22, 5:42 PM. So I would say that's a 22.
So in 22, he did.
He did 25 hours, and they were all with
All visitation.
visitation.
Okay, so he's been turning that in, it's getting there, and that audit process has been brought to my attention.
Well, let's bring him up to stuff, right?
So-
Knock it off.
I gave
do
him
what
an
everybody else does.
extension and told him I would ask.
How long was the extension?
6 months. What was my journal note?
Plenty long.
You're too nice.
Yeah.
And I was going by what they did in
6-month
21,
extension.
was a 6 months extension.
From March.
And when did you do that?
4/16/20.
Oh, okay. We got till October, so.
Okay.
Yeah. So you know, you need to get your CE requires for
Okay.
this past year to get you up to speed
That are separate from,
In the appropriate,
in the appropriate
in the
categories.
appropriate categories.
Per the Practice Act.
Yeah,
Yeah.
because that, and basically, we're
Or
just,
rules, I guess.
we have his application, what's his status in there now? Is it still pending or do we make him active or temporary? So I just wanted to run it by y'all, but I don't, what is your opinion on that?
We have him active and expiring on 3/31/25.
what's next?
So we renewed it with this caveat that he's gotta get some CE in here. Cause he paid his fine, he had all this stuff, and this CE is unacceptable.
I would say the 6 months was way more than generous.
Yeah.
And he's been basically given a free pass for the last 3 or 4 years.
Yeah.
No other veterinarian's getting that same free pass.
Okay.
I mean,
But he's
considering
got
you,
an active license until 20.
next year.
Till next
So he
year,
has.
to the full
He
renewal.
He has. a
He has a full
Pending.
license, he has a full license, and he has a 6 months extension on last year's CE, but he's still got to qualify again for 25 renewal.
Gotcha.
And if he doesn't comply, can you pull his license?
Yes.
Okay.
Which is amazing.
But his license
We're,
is,
we're reading through all these
but his
cases on
license
other.
is good till the end of March, so is somebody going,
Get your license pulled.
Would be charged up to
There's some
$250
16 hours
a
of
day.
CE and then,
Andy
Or
has
you
5
can
years
maim
on
animals
expiration to
just treat
reapply.
the public over and over. And you still out there doing it.
So since there was some board action on that, and then that's why we were bringing this to the committee specifically, that administratively, we gave him an, extension on his CE, and I told him, I said, that's not gonna fly.
Considering you can walk into the winter meeting, sign your name, grab your packet and walk out and get all your hours that way, which is no peace of mind.
I linger.
Yeah.
You're
We
We hang out at the VIP.
Yeah,
That's right.
that's, considering you can do that and get all of your
Hey, 2 donuts
hours,
and
there
a
is
cup of
no.
coffee.
Hershey bars?
I had at least 3 old buddies.
How many-
Gotta go see a couple of booths, get that swag.
That's right.
That's right.
Okay. I just want to run that by, to make it due process.
So we're telling him he's gotta get right.
Yeah, you've got to get us,
So all of his
He-
back
he
hours
has
plus all of his new hours.
he has 2 legitimate hours,
It's
so
gonna be
he owes
busy.
us 18
He
hours.
needs 18 more.
18 hours for 23.
3
plus he needs to
Plus he
get,
needs his 20 for 25.
separately done.
Yeah, and we'll deal with that on
Yeah.
25.
but I would make sure that you address that with him.
Yeah.
To make sure he understands this, you don't get to double count them.
Yeah.
Yeah, because I mean, and the comment was made that, well, he'll just not get renewed. And I said, okay, you can go inactive.
Yeah,
And
sure,
you can
that's
go
his
inactive, it's
privilege.
fine.
Same with anybody else.
I think
Yeah.
you're being more than generous with
Okay.
what you've given
Yeah.
him, so,
True.
all right.
You want to write this letter?
Any, the next item is the xylazine discussion. Final rule and comment from Arkansas BMA and email below. This information only, no action required.
Yes. Yeah, I was just putting that out there to you guys that there was some action on xylazine. We did get the exemption and there's the verbiage on that. And so I just was passing that along to y'all as leaders of the pack.
And you can go to the ABMA site and look at what they're doing on the federal level and how it reflects to this.
Okay,
Okay.
any discussion?
We did good work. Right?
Yeah.
We did good work.
Got it.
Good job. The other item that I had is, we kind of had earlier in the day was the or not the application process, but the form for filing a complaint, what rewording we wanted in that. If you want to take out one of your forms or if somebody wants to pull it up. What recommendations do we have for staff on what we would like done with that?
I would say, just putting guardrails here, again, being the lawyer. Sorry,
Good job. All right. We
You
forgive
don't
you.
have to apologize for
but,
you.
You should, but you don't have to.
I got a 1-year-old kid, so I got a different job. So, we can't compel anybody to say or state anything unless under due process of law, which the commission has by its subpoena witness power. But we can always put very strong language on, please, here's some tacked on papers. Could you please provide a statement if you're so willing, because that actually does help. Like if this person is
voluntary
actually
statement.
there, please volunteer a statement.
Statement to corroborate.
In order to help your case and to help the
We've seen
community
it.
understand.
Yeah, right, attach,
all witnesses.
attach pictures or witness
Photos.
testimony, yeah.
So do you need specifics that we would like added to this, Candace? Or do you got, staff want to take a stab at enhancing it? How do you want to work that?
I say we write something up like Tanner Blessed.
Okay,
You can legalify it for us.
Legal fine.
So I think one thing we would like to add it
I also
is
certificate.
stronger language around witness state or around, it says list persons who can confirm all or part of your enclosed statements, maybe something along the lines of, please, please include, that doesn't say it's a requirement, please include any witness statements, photographic evidence
That might support your,
that can support your, yes.
if you can legally do the, let's please not have the he said, she said.
Or, you know, Arkansas Livestock and Poultry Commission highly recommends providing
Yes,
Yeah.
witness statements
To back
With
up
the-
your
with the initial
claims.
package.
and gaining the permission of your witnesses to have department officials contact for further information.
Because it is right now, just listing those names doesn't give us guarantee that they give them permission.
Yeah, they may not even.
They may not even know that they're on.
What about also putting on the website where they can find this form, that voluntary statements in corroboration are highly useful to your case?
I would just tag it on to what we got, you know, just throw it to the commission, say, hey, we need this approved, this make our life a little bit easier.
Yeah.
Let us call folks if we absolutely needed them. And then you actually don't have to follow up with these folks if you don't, we could just have it for a witness later on down the road, you know.
Well, many of these cases, like these witnesses, the puppy going to New York, who is there to call? What more do we need to know?
Yeah, a lot of
But,
times it wouldn't help, but again, a lot of these
you know,
subjective ones that.
I said she put a human ointment in the dog's eye and didn't protect the eye and didn't do, she says, no way, he only did, well, those are completely opposing statements.
One thing you could do, you know, if y'all want to take it to this extent, is you can add, if you don't want to include this item, then we won't consider your complaint.
Or your complaint may be returned to you?
I don't think you can do that, because, I mean,
Well, I mean, the wording could maybe be, this would strongly help your case, or that could strongly help your argument, or back up your argument. Because we are kind of a little handcuffed when you do get the, well, I said this, no, I said that. And we're stuck now, well, on paper, which one are you credible? Especially when we have to take it as this is the one and only case.
and in the meantime, if all else fails, the commission does have supreme power if something goes to hearing. Y'all aren't making the judicial decision yourselves, so if something's up and y'all think something stinks and we can never get a hold of anybody or anything like that, that may be, say, hey, we've got to investigate this further, we just got to send it somewhere. That's what a hearing's for, is fact finding any determination about the deal. So, but this is a fantastic idea to really, please help. Type deal.
Please do this up front so we don't have to chase you down later.
any other comments that we would like?
The great idea.
How about PTS that we were talking about the other day? Are we clear on the veterinary technician specialist versus technology specialist? Is it maybe I'm not clear. Is the VTS, can a veterinary technician graduates BB, 2-year program, practices 5 years, they can become a VTS?
Yes, with the hours of continued, I think.
Right, but it's not a 4-year degree requirement.
No,
Okay,
no, it's only associates.
okay.
And it can be an online associate's degree, right? And then that 5-year requirement is not part of the BTS law now, as currently amended, is that correct? Because now, I've not seen anything about that caveat of 5 years of technical service in the field.
I know there is.
I know you still have to apply to the academy and you still have to
Right.
complete
There's
those.
8 hours of additional CE that you gotta have.
We decided that, but
each
it's,
year.
originally it was the
Originally, it was a 4-year technology degree as it was first proposed.
completed.
Veterinary technologist plus
Yeah.
5 years of in the field experience,
Before you could even apply.
mentorship. Then you
And
could
that's the
apply
issue
the
is that-
academy.
It has changed
Then-
from the original intent
Oh, yeah, it's been amended.
in the first battles.
Right.
And I think it's still very unclear. If we're asking those
Well, it was
questions-
interesting.
That's unclear to me,
We had
yeah.
the same question as
I'll send
Senator
home.
Hill.
the same-
Senator Hill did not even know it had been amended like that. He's like, really? I wasn't aware that had happened. And I mean, not to most people aren't. So I was curious, like on the amending, since it has been amended from a four-year veterinary technologist degree, it can now be an Associate of Arts veterinary technician, degree. And then, but I was told that they've also removed the 5 years
I
of,
don't remember that, that's.
basically apprenticeship or
Yeah, because it was 5 years of work in that field
in the
before you
field,
could apply
before
to
you
the
could
academy.
apply to the academy
But
to.
if they can apply to the academy right out of
Lead
vet
us,
tech school, then
That's not great.
What do we do? What do we say?
Well, first
What
is that true?
What is,
Is
yes,
that legit?
The confusion is, well, there are still people that get confused about technician and technologist
Correct.
Yeah.
Mhm.
and veterinary technology.
correct.
The,
Veterinary technology is the practice of veterinary
Well, so-
procedures. Okay. Technicians, 2-year degree, technologists, 4-year degree. Technicians or technologists can go get a specialist
Yeah,
certification.
right.
The
Here's your
academy
special-
sees
The
them as the
academy.
same.
Yes, here's your specialization.
does the veterinary technologist also have to, graduate from an accredited, facility?
It's a 4-year program.
Yeah, they're an
Those are
accredited.
gonna be accredited.
Mhm.
Now, I don't know if we put the words accredited in there, but,
AMA has
Well,
very
again-
clear definitions.
and that's where we all need to go
Thank you.
away from all of these. We need to go to the AVMA. Here's all the accreditation standards. Here's the veterinary technician, technologist, accredited schools and programs. And then there's the specialties that are accredited or recognized. I think they're more recognized.
but if it's not in the law, then none of that matters. So if it just
Right.
says
There's
CBT,
the point in that,
Thank you.
yeah, right.
is that those are all nice
Where we are.
frameworks or guidelines to
I
follow.
mean, you go Penn Foster
But if we
and get your
legislatively.
CVT. And then if they took the 5-year thing out, then you could potentially be a VTS
3 years.
in 3 years.
The big confusion is that the requirements of the statute have that technologist
Mhm.
and the requirements just kind
Mhm.
of team through each other.
Yes, when those rules were written.
And, it's,
So if
but they got two different definitions in the general provision section, so you
Right.
can't understand what the heck's going on in that one without going back to definitions there.
Right.
Then going back. So the whole thing, we're just looking like it's just weaving, like, are they talking about the same thing or what?
Well, as
I
they
guess
amended,
it's implying that you must hit these requirements for this specific technologist. This is the requirements, whatever they are. For this one, you gotta get it. Whatever the ones for education, this one,
Right.
you gotta get it.
And that's directed by the AVMA.
Yeah.
And
but
so
once you
our-
get there, do you require an additional 5 years of work in the field? Or
Before
can
you
you come out as a brand new graduate and apply to a specialty academy? I think they struck that part out too.
It's
It was in the
not.
original.
It's not in there, okay.
It was in the original.
That
Yeah, well, it totally was in the original, but I mean, those are the questions I'm getting and I'm like,
Yeah.
I don't know. Cause I also wasn't aware that 1182 had been amended to be a VTS bill. We talked about it before, but they also amended out the 5-year.
There were several amendments.
Correct. Yes. So,
But see, I don't know if they could amend it out of an AVMA sanctioned entity.
well, that's only if the state of Arkansas agrees.
In
to go
Arkansas,
by
if they
their
call you a
guidelines.
VTS in Arkansas, then
Yeah, we do what we want. For better or worse.
Yeah, cause I've got
what's that say?
the NAVT. This is what is a veterinary technician? What is a veterinary technician specialist from the National Association of Veterinary Technicians of America,
Okay,
which reflects,
so how do you become a
Find it.
veterinary technician specialist?
let's look at
So that's
That-
part of,
it
that's
is.
our practice act code defining that. Is that correct? Mhm.
The definition is where you split the hairs on these,
Right.
and then, let 17-101-306 is your licensure.
I mean, process of education, though.
Yeah.
Process,
See,
education,
that
training,
Number
experience.
18, if you look at it, I think they struck out the part of where you had to have the 5 years.
I mean, how much
Of,
experience are they talking about?
Right. There's no,
Originally
no
it was
requirement
5.
on that.
Right.
But we only define a technician specialist. We don't define a technologist specialist.
Well, prior to that in the act, it says, in this act, the
Or
technologist,
technologist.
they're one and the same in the eyes of this law. I
Okay.
do remember that.
Okay.
But, yeah.
Yeah, because
And
the
so it's-
AVMA talks about a veterinary technician specialist going into advanced education in the specialty academy.
And then we're using their standards, and that's where you get the 5 years.
Well, and I had a phone call from a registered vet tech who just graduated, passed the BTNE, wants to apply to the academy, and said that I have to be out 5 years to do that, or I do not have, or do I not? And I said, I think you do, but then they sent me a thing saying, well, actually, you do not. So I just wanna make sure
Arkansas?
Arkansas does not require for a VTS in Arkansas. That was why. That was my.
Who sent you that?
I get the text. It's she's a recent graduate from BB school and passed the BTNE. So she
I know,
wants to
but
apply
somebody
to a
from Arkansas
specialty.
told you they don't have to have 5 years.
That's what she just said. I said, well, and I think she's right. I guess I started backtracking and realized there were several amendments to that.
So that definition circumvents the AVMA standards.
Yes,
Because, yeah, the veterinary technician specialist has advanced education through an academy, and you can only get into an academy if you've had 5 years of experience.
Well, maybe that's it.
well, maybe the
That's what I'm
academy.
saying.
So we-
is that
Then
you
maybe
have to
the
go through
academy requires it, but the state of Arkansas, so maybe they're gonna have to do that. I'm totally
So you
wrong.
think the academy requires the 5 years experience before you can apply to it?
Correct.
If,
Okay.
if,
I believe
They do
that.
require
So
it.
maybe
They
an
do
academy,
require
maybe they left it
They
out.
require
and
years
edited
in
it
case
out
studies
because of
and
that.
stuff.
if it's a requirement, for accreditation
Control.
Yeah.
from.
Maybe that's-
I'll have to hunt her down and,
By AVMA.
uh-oh,
Yeah, so it doesn't have to be there as long as it's there. Now, they could change their standards at some point.
right, okay.
And that might be why,
Very
because they have the
Mhm.
freedom to change that on their own.
Right.
Okay, but Arkansas edited it out apparently of our amended version.
But when this puts it back on, the onus back on there, you've got to go to NAFTA and fulfill their requirements to be the specialist.
Okay, well, there, okay.
Because one of the academies
Mm.
was food production,
Mm-hmm,
and that was the whole push.
sure.
Was to get the VTSs that had the academy credentialing, that had the food production, that could go out and do what we needed them to do.
On the
to do what
farmers,
you needed
right,
them to
that's
do.
what Meg.
That was the
pushing
whole-
for, right.
With Meg, that was the whole foundation, and it got
And they really are anxious,
mind-boggling.
they really are anxious to get their technologist specialist license certificates. They're really anxious to get those, but we are thinking, there we go, that we think, we are under the idea that we want to put their specialty area on that certificate in some shape, form, or fashion.
Yeah.
That you're a veterinary technician, technologist, specialist in the
Food
area
animal,
of
Yeah.
blah, blah, blah.
Yeah.
Mhm.
Because you can do general practice, or you
Exactly.
can do anesthesiology, or you can do, so.
And then if you walk in and, hey, this is your specialty area, you can't be doing that.
Yep.
And you
Right.
displayed your license, and it's up there like everybody else's, and you walk in or do something different, we need to talk.
So now we all understand that, and now it'll be
Yes.
interpreted again.
Now we need
Because the way
to have a
it's
clear
written is
position
very
paper that goes
convoluted.
out to people to
Yeah.
understand what.
Another
yeah.
position statement,
The rules,
the rules,
the veterinary
PowerPoint.
practice rules imply that, hey, you probably need to be doing your specification. But there are absolutely zero penalties attributed to not doing specification, because these degree programs do have specifications to them. And those are the accredited programs that you are doing yourself. So you're an accredited, whatever, VTS with a specialty in there. That's what you got your degree in, and that's what it is. But I mean, just, you're asking people, say, hey, can you please only do that? Thanks. Cool. And I don't want to, I don't know if y'all want to slap people on the wrist or just, give guidance in a certain direction or anything like that. That's what y'all decide, but, is implied, but it's not really there.
And it'll have to be in their
You
agreement.
can't do anything.
Or do anything on it.
Interestingly enough, we've been asked by the. law
I think we
enforcement
start
to
with the
help them
people
write
that
a
don't have
better
any
law, a
veterinary
better
training
rule, or a
first.
better amendment, and we're trying to kind of as a group, one is wrap our head around what is the current law and the rule, but also what are the problems with it? How do we fix it, make it better? So, because there will be a law and there will be a rule and we might as well all make it a good one.
Make it
Right.
good,
So
clarify
that's
it.
kind of some of that clarification stuff is, well, what is it now? What's wrong with it? How do we fix it? You know? Fair enough.
And I'm just standing up because my head.
Can a non-veterinarian be a partner in a clinic in Arkansas?
Oh, yes, that was one.
Would that-
More new business?
As in a partner
Well,
in business.
And I've been asked that as well. I mean, based upon the corporate
They
licenses.
said they couldn't hang their own shingle. I mean, that was.
No, if a veterinarian's a majority
It would be,
partner, if you've got a minority investor that wants to own 49% of XYZ Animal Clinic, but Dr. Smith owns the 51%, can there be a minority partner in a veterinary clinic, non-veterinarian owner, partner in a veterinary clinic in Arkansas?
It may depend on the corporate structure.
That makes it,
If
yeah.
you have a corporation,
But
and
don't-
it is a
Have that.
professional corporation, not a PLC or a partnership, just full stop. Me and my buddy are practicing vet medicine. He buys stuff, I do that stuff. There might be some wiggle room in a corporation, just like any other corporation that has shares.
But you may have gotten the
Any
same
other
question I got
corporation.
then.
I got the first question. Yeah, they bombarded me with that. And I
But,
said, just as a corporation allows it,
an LLC or a PLC, you can't be a member.
no.
Can't.
You can't. I forget where it's at. I answered that question for him once.
I've got number 9 under 17-101-203. Regulate all veterinarians in a corporate practice and prevent corporate or non-corporate holdings from being sold to, directed by, or controlled by a non-veterinarian.
So there we go.
And then there was another piece that's floating out there in my brain right now that,
Didn't just 2 meetings ago, though, we approved the Hounds
But that
Lounge?
was for the
It's a corporate.
boarding or something right next.
Well, see, I
If it's a
I
corporate
asked
entity.
a fellow veterinarian that I knew is corporate owned,
So,
and she says she owns 5% of her practice. 95% of her practice is owned by a company in New York, right? And I said, well, how does that work?
Yeah, all these big corporations.
And it's because I'm told, because then we did vote for, like, we had several people trying to be corporate practices and it was Dr. X LLC, Dr. Y LLC, and all 3 of them had the same address in New York. So I'm assuming a lawyer has found a loophole on how to sign that up. But I'm under the impression that if it's a corporate LLC, that if the LLC's name is in Dr. X's name, then Dr. X technically is the owner, even if the corporation owns 95% of the stock is held by company Y that has no veterinarians.
The
Is that,
corporation itself and the statutes around, even with human medical doctors, it's a little bit more clear with them. And that we are riffing off of that a lot, and it kind of refers to that, Professional Corporate Practice Act.
the question we
But the
got
corporation
apparently,
deal, you know, can I have a bunch of shares in, you know, Vetco, or whatever made up thing, with corporations, you typically have voting power as a shareholder, different things that would probably really run afoul of the statutes that we have.
we have a rule as well under corporations at number 13, veterinary practice may be by sole practitioner, partnership, or duly registered corporations. Only licensees may be partners.
Yeah.
well, so I guess you're the licensee is Dr. X LLC licensee owned 95% by the corporate.
Yeah.
But the reason, we all apparently got the same email from the same person and we were all independently trying to answer it. But it turns out there's a veterinarian in Arkansas that's trying to sell his clinic to another veterinarian.
Mhm.
But this veterinarian wants to also offer a piece of the clinic to a technician who works in that clinic. So the new veterinarian and a technician that worked there want to go together and buy out Dr. X. Are they allowed to do that?
Like ours.
There's certain cooperative and practice agreements, y'all may have actually more knowledge than I have. I don't know if that encompasses.
I directed them toward the vet I knew that was
That's
corporately owned.
It also depends on just the structure of it.
Okay,
And in these statutes, they deal with professional corporations and professional business associations. Stuff like only licensees may be partners. Does a corporation have a partner? Yeah, and typically they don't. Corporations typically have,
stockholders.
shareholders.
or-
Depending on the type of corporation, you have an S corp or, LLC doesn't have partners, partnerships have partners. What do you mean by that? You know,
Well, hopefully I directed them toward an accurate answer, because
And we don't have a
Seems
definition
not.
for partner.
and I can
It just says they can't open a practice on their own.
Yeah.
So I don't-
Shingle.
Then that's specific. And what part?
Well, that's happening a lot, is corporations are coming in and buying practices, and then I think the mindset was somebody on the board has to be a veterinarian.
Yeah.
Yeah, but I'm looking at the corporate structure of one of those corporations and there is no veterinarian listed at all, and they own at least 11 practices in
every time
Arkansas.
I get hit up, it's.
Yeah. There,
me
there,
and me, and we're
there
gonna
is
buy
no
you.
veterinarian listed, nothing.
I mean,
That's been the
Partner
understanding
to mine,
ever
so
since
that's
I've grown
not
up in it.
I am the registered veterinarian, and I've got my percentage, and I'm the medical director, and I make all the medical decisions.
Mhm.
Corporation is there for buying power,
Right.
And profit margin.
But they're
and
the
profit
owners.
margins, so they're, yeah, so
But
they're.
but again, the
my-
owners are supposed to be veterinarians,
But if
right?
they own more than
Right.
51% of your practice, which all those
Exactly.
corporate
Not
people
Let
do,
them do.
they have to, because,
They can own as much as you want them to own.
I mean.
I mean, that can
in
be
the case of the
5%,
one
that
that
could
I
be-
talked to, was 95%.
95%, depends on what structure you've agreed with that corporation.
Right, I've never had
What that
anybody
means.
offer me 49. You know, they don't,
Nobody wants
they
to be
want more
49.
than 50 because they're the decision maker,
Mhm.
which is, and that's legit, that's business, but.
I mean, there's a
guess,
corporation
uh,
coming in, buying up clinics and closing them down. I don't think the veterinarian is exactly excited about that.
Right, and every corporation has their own model. I mean, like with Alliance, I'm the
Yeah.
medical director, I've got
So they're
the
buying
final
them and closing
say-
them to open the gate to telemedicine.
Yeah, I don't know if I can say the name of the company, but they're doing it all over the nation.
Well, that's the
There's
only
so
reason you
much
could come to it.
change.
Why would you buy that and shut it down?
close the
But you're a
practice of
direct
veterinary medicine,
competitor.
and
Yeah,
maintain your
Yeah.
building. Unless it's a real estate.
yeah.
I'll check that
See what
one.
that's worried about.
How about this? I've dealt with this from a whack-a-mole type deal, if there's been some, and we haven't really had any of these big questions come up in corporate practice applications just yet. But everybody's talking about it, and I haven't really systematically thought about it, touched on it.
Yeah.
I can put together, a presentation or something, and we can, I
Well,
can bring that to y'all to
Mhm.
provide some sort of clarity. Cause I've thought about it and I've looked at it and then I step away from it and I completely forgot, after I answered this one question that Dr. Niles might have had. And then haven't saved my research or anything like that. I have to go back through. So I can put something together for everybody to.
I think that was the one
We
was.
previously saw all those corporation
Must
application
all
packets,
veterinarians
and we
have
all kind of
corporate
scratched our head.
Yeah, that's a.
We haven't seen them lately.
mm-mm.
Cause we've gotta know about all the veterinary practice in the state. So if you've got a license to practice veterinary medicine, we need to know where you're practicing it. And how do we know that? It is, and my address is my house for my license, and I don't practice at my house. I practice here. I practice all over the state. In regulatory medicine. So that thing, when you sit there and you think about this and you look at it from different angles, it's like, I need to know where everybody's practicing medicine.
Right.
So I can come look at it and see what you're doing. Now that we have assumed that and we are thinking about going out and looking at those and auditing things,
So
I
with
need to
that,
know where you're practicing. Do you have your license up in your van
Mhm,
with your renewal card?
mhm. I mean, it's in a binder, but it's easily accessible, yes.
I
But
think
I'm
it has to be
probably an
visible. I
exception
think
to
it's
the-
supposed to be
It's a
visible.
clear binder.
It's
It's a
visible.
clear, it's in a clear page protector.
On top?
Anybody can photo.
Yep.
Would that have to
It
be
will be
corrected
tomorrow.
with the license application?
I also have my
when
OSHA
people
law
apply
poster
for their
rolled up and
license.
ready to go too.
Yeah.
Yes.
Work comp, guys.
The shade curtain.
I know.
Yeah, no, well, and I
Set
mean,
it up.
I get it, like, I registered to my house for all my licenses, but I practice all over central Arkansas. I get it.
And I
Yeah.
wish the application would have a physical address and a mailing address, because I can't have you send anything to my physical address because the corporate office doesn't allow it,
Yeah.
which is a big old pain in
Make
the
note.
backside.
And
We wanna look at everything and say, okay, what do we do here? How do we make it better? What are our needs as far as the application process?
Cause you
I-
just ask for an address, a mailing address.
Exactly.
But you don't ask for a practice location address.
That was something that came up on that one we approved today, was he wanted to know, do you want my corporate address or do you want my physical address? And I said, if there's somewhere you can stick both of them, we'd like them both.
Yeah,
And so I think he put it on the application, that John would, rather, one that we did,
What physical address of Bentonville?
he kind of put it in parentheses. And I did,
or you have like a primary, like home address, work
because the
address.
corporate address on there is actually a New York, address, I don't remember.
I have a question on a new topic if we're done with this one, but I don't want to interrupt if we're not done.
Whoop that horse.
Telemedicine. So my understanding is telemedicine is not legal in the state of Arkansas, like unless you have an established VPCR, you've gone out and like physically seen the animal. But I've been getting more and more people coming into the ER saying, well, I talked to this vet on the phone and they said, watch them for a day or two, but I don't think they're right. And so now I'm here.
Yes, well, I was getting that when I was over there.
Yeah.
That they
But
would
how
call
is
up.
that legal?
The
How
ones,
is that, how are those companies able to operate in Arkansas?
well, the ones that I had experience with, they said, if you like this information, make a donation here.
Give them a 5-star rating or
So-
whatever.
Okay, so Arkansas Pet
So you
Poison,
didn't.
I love them. I love this
So
company.
you
I
didn't-
don't want to call them out,
Yeah, you
but they have to
didn't-
pay money to get a recommendation from them. I can't work for them as a vet in Arkansas because telemedicine is illegal, but someone from Virginia can talk to them on the phone. It's very gray to me and
Any of those, if they're prescribing meds, they're.
Is
it's
that
on a
where the line
very-
is?
Very limited,
Take a payment too.
3 to 5 days of medication, and I've had a client walk in with
with a script.
like a script from a
Yep.
veterinarian, and I said, I'm so sorry, but I don't want anything to do with this. You can-
I'm brain locking
Denied that.
on that telemedicine is illegal in Arkansas.
It's not,
It is
it's
not.
not illegal.
I thought it was.
We have,
No.
I'm sitting here looking at veterinary telehealth and telemedicine.
Yeah.
And you can do it, but it's at VCPR.
Exactly. No,
It's
that's,
illegal without a VCP.
that's what I
It's
said.
illegal without VCPR.
Exactly. That's what I said.
Well-
So like,
And then in Arkansas, the VCPR
Has to be made by the veterinarian in person.
It has to be
In
by
person.
veterinary, lay hands on,
is
lay
in
on
person.
hands.
Yep, and many states are changing those rules
Yeah,
specifically for
that's-
that.
that's
The
what-
AVMA is struggling. to
That's
get
what the
theirs
legislature and all that's working for here on next session is to
are
to
different.
get a telemedicine bill passed here where you can make the VCPR.
We have a Zoom meeting tomorrow night with, Colorado's, Colorado's VMA, because their House legislature, their top legislator in Agri in the House of Colorado is actually a veterinarian.
mhm.
And, a big story, but they tried to pass a telemedicine bill there that was driven by the Mars and Drive and, Dutch something pharmaceuticals. I've never heard of them, but everybody else had. And anyway, this one veterinarian managed to shut it down because of her position as the senior legislator in agriculture there in Colorado. They redirected it now to making it a ballot issue that Colorado people should have direct access to telemedicine and without a VCPR and without it. So she did pass a telemedicine law
Mhm.
because there was gonna be one. And we're going to have next month, they're going to have a conversation with some lawmakers.
Oh, okay.
Because of exactly that. There will be a law. It would be nice if we can uphold.
They're gonna do
I just had a
something.
couple where it's like, if you had just come to me 2 days earlier instead of talking to this vet on the phone that can't
Sure.
see your dog,
So,
I could have fixed this.
yeah.
Because the AVMA's position is that valid VCPR is in person.
Right.
Telemedicine comes in and attempts to change that or
Mhm.
state that an on-site visit must be conducted within 14 days.
Yeah.
So there's a lot of those pieces that are coming in and
Oh, no,
14 days.
full
federal
well,
level
too,
is
that
working
you're-
on it and the state level is working on
You
it.
may or may not even go back to see that vet in 14, 15 days. So would you break a law or something?
Right,
Yeah, I mean, they pass those laws knowing full well that ain't gonna happen.
right.
And by the way, that is sponsored largely by the Chewies and the Pet Meds and the, because now.
And I think that's what kind of triggered it for me, because Chewy's offering telemedicine now.
Walmart
I think
is
it was
offering
Chewy.
telemedicine. by the
Well,
way.
yeah,
Walmart has a new
Mhm.
big platform.
and
that
so I'm just trying to figure out, like,
kind of-
how is this playing out in the real world?
Get really active with the Arkansas VMA, because 2 years ago, 4 years ago, I would have told you it was a waste of your time. I would have told you not to donate to the political action committee,
Mhm.
and I would tell you now, it is not a waste of your time at all. You
That's
have
good to
fellow
hear.
veterinarians down there duking it out 24/7, and I say not that, developing relationships with lawmakers.
Yeah.
And literally having a voice in the process. And 4 years ago, I would not, like 2 years ago, that would not be true. 100% accurate. right
That
now.
was my introduction to the Arkansas VMA, was
Certainly,
the back then.
yes, and
Mhm.
I've been a vet here for 35
Yeah.
years, so I've checked that box every year for 35 years, and I'm always willing to help.
Mm-hmm,
Never got a phone call.
exactly.
And always assume, well, you must have everything well dealt with and handled because of the fact, but I will just tell you that whole different, new sheriff in town, I can promise you that, wouldn't you say?
Yes, absolutely.
So work through your Arkansas VMA so that your voice will be heard, but also tell them your opinion, because we value that, they value it.
And
Get
new,
involved.
new bylaws coming in 25.
Nice.
That restructures the whole, association.
A lot of change.
A lot of change.
It's exciting.
Have you seen it? There was a draft that was sent out. I think it was sent out to the public.
I
Did you
don't,
get the Arkansas VMA?
I probably do buried in a email that.
Please do, open them.
Now
Yeah.
don't throw those away. If you see the Arkansas VMA, read them. Everybody read them. So I don't know if we can, I mean, telemedicine is such a broad statement.
Yeah.
Well, it's,
But it is, it's
it's,
a hot topic.
It's coming.
it's the establishment of it.
Oh.
I feel like we
Well,
need to have a separate hot topic
As
meeting.
soon as I get it set up here in a minute.
To hammer
Yes,
some of the
and that's
things.
the reason.
Maybe one of those things where we
McCormick
come in and do
is,
like an
conversion
afternoon
to
meeting and then
our
a
legislative
morning meeting the
committee
next
is
day.
ready.
For those ones that are coming from out of town.
I'm trying my
on the
best
other
to
night. Yeah.
do everything
And
through.
we're not doing
Arkansas
such a
VMA,
long
Let's, the correct
day, long
channels,
meeting.
and it has been,
Kind of a little,
Uh-huh.
you know.
by the end of the day.
It's Monday, but we shouldn't.
Yes.
You can get it just good now. I
Okay.
just- I didn't either.
We can have.
Let's put the agenda thing, we need y'all to do a sign-in sheet so we can get reimbursed for the meal
Are there,
and sign your, TR1s.
here,
And
I'll
leave
start
them
the
with it.
sign-in sheet.
Yeah, on this, we just sign it and put the miles or
Just
what are we?
sign it, put it on files, that's all they need.
Do you just need our
Can
name?
Bring more telemedicine information back to you.
Huh?
later.
There you, oh, sorry.
Do I?
Sign-in
Bring
sheet.
more telemedicine back to you later.
Any other new business? For the next meeting, do we want to have Tanner was gonna prepare some information around Corporate Practice Act or corporate practices, not
I'd like
corporate
to
practice
talk
act.
about that now.
Some of these hot topics, do we want to have kind of a meeting where maybe we meet in an afternoon and then meet the next morning to cover some of these things where we can do cases and some of that and then dig into other things? Do we need more time than 11 to 4? Are we good with that? What are we thinking we want to do for next meeting?
I think our meeting time's fine. The one thing I don't wanna do, and I mean, that's one habit I try to never have is to give someone the shirt off of someone else's back. And we've just asked Patrick and Tanner to go out there and back us up on some stuff and I would like to make darn sure that if you send the sheriff out into the street, you don't send him with one bullet or, and
We
what
don't
I.
need Barney Fife around here.
100%. So I do whatever the tools that they need to, we probably don't need our help on cease and desist stuff, but whether it be legislatively or whether it be administratively, whatever we need to do on our
Yeah,
end.
if any of y'all know your senator, your representative, again, it's gonna be well worth building a relationship. What they were talking about with the Arkansas VMA, the restructuring is gonna help, but everybody I've talked to in the legislature and the Senate does not have a great rapport with the Arkansas VMA. The lobbyists and the people they talk to and stuff, when all these bills came up, they got a real bad taste in their mouth for the Arkansas VMA. And so I think we got some repair work to do there, because we can sit here and preach all day long about what we want to do. It doesn't mean anything. We've got to get the legislature and the Senate to pass these laws. And so, again, they're getting hammered by other lobbyist groups. And so if we're not doing our part of building that relationship with those politicians, it's all for naught. We can sit here and make all the recommendations we want on how we want all this to go. It's not gonna mean anything unless they pass it. So we're at their discretion, and we're recommending things to the commission, and then the commission's gonna, hopefully go to somebody. But if the committees and stuff in the House and the Senate are not on our side, none of this is gonna work. So again, if you take the time, and we've been trying to build those relationships and let them know that, again, our profession is there for the public. We are not in this just for the money. We are capable of doing all the jobs that need to be done. We just need some help from them to help distinguish us from non-professionals. And that's our biggest competition. So if you know anybody, or take the time to introduce yourself, it'd probably be smart.
Many years ago, state associations did not play the political game. They only crossed over to the political side when it was absolutely necessary.
And then it's too late.
State associate, and it was always too late.
It's always too late.
Legislative teams, but now most states now have very active legislative committees and PACs, because associations didn't play politics.
Yeah.
They were there to mentor and lead the association, and not, because the examining board,
It's very
they were
idealistic.
responsible for the other part.
Now,
But
Rob,
now
you
it's
tell
a-
them the story about the optometrist and
A whole
ophthalmologist.
different ballgame. It's a whole new rodeo now.
Yeah.
So I think that Arkansas needs to be strong. And because we have been perceived across the nation as one of the 5 states that have the least amount of laws in regulatory authority, even from the examining board viewpoint.
Mhm.
ALPC is there, but it's evolving. And we didn't play the political game until the last 10 years. But these two have been, really appreciate them stepping up and advocating and using your skill sets.
Mhm.
They're our rock stars.
But this make sure we put some wind in Patrick's sails if he's gonna have to go out. I mean,
Yeah.
I really-
Whatever you need
It's an
from us.
unenviable position to be in.
Yeah, I mean,
To be out there in the climate, so we have to create a more favorable climate for him to operate in. I mean,
Yeah.
That's just incumbent upon
I
him.
mean, if folks are
Really
providing
humble.
counter arguments, like, let us know what we can do to help research and give you
Yeah.
counter arguments. Yeah.
Appreciate you.
Do we want to attempt to set a date for the next meeting? I know we changed it, but,
Make it work, and we'll make it work. Put in-
do we know when the next, I know we've tried to do it before, the next commission.
Commission meeting's the 27th of July at the Arkansas State, 26, yeah. It's at State Cattle.
So we thinking quarterly, so end of September, beginning of October, is that what we're looking at?
Sure.
I don't know. September sucks. We look at-
September is not good.
I mean, it doesn't suck. I'll be in Spain for like a week and a half.
Oh,
but-
bless her, yeah.
Oh,
I was just thinking of calving season and, you know, Spain wasn't on my radar.
could do like tentatively October 2nd, depending on how that lines up with,
Tuesdays and Thursdays were a lot better for me if it
Can
doesn't,
we look at the
okay.
week after
but if it
that?
doesn't for y'all,
Wednesdays and Fridays are better for me.
So are we looking at the second week of October right now,
Sure.
or the first week?
6 of one, half dozen the other for me.
I was gonna say, I'm gonna do.
It's far
the-
enough
First
out.
week I could, as long
That's
as
4
it's
months,
the
right?
end of the
I'll
week.
put it on calendar.
Get it done.
The 8th or the 10th?
You don't need me, but, like, that's the National State Veterinarians Meeting is the 10th. It could be a Monday, Tuesday. I think Wednesday will be a travel day. But you can proceed without me.
Or 15th, 17th?
Cause you would be here on the eighth.
Or the-
I would be here on the 8th,
Tuesday, Thursdays are better for you.
October 8th.
Not necessarily. I got just conflict.
Yeah. I'm just
September,
a-
October, or just.
Yeah. I'm just a one person practice, one technician who only works with me on Tuesdays and Thursdays.
Oh.
That's why I'm-
That's,
Wondering if it's possible to do a Wednesday or Friday.
Did we knock out the first week of October? Like, the second?
The first week
I mean, I'm fine with that.
works for me.
And if we get closer to that date, we need to change it. You know, you send out the notice to change it.
Does the second work?
I won't be here, but we don't necessarily, we may not always
Are you
have.
still gonna be in Spain?
No, I'll be in
should be in Belgium. by
Salisbury,
then.
Maryland.
What about the 9th?
That's when you're going.
That's when you're going. What about the 16th?
The 9th. Yeah,
16th
that'd
is
probably be a
beautiful.
travel day, but you guys do not have to have me.
How about the 16th?
When's your other trainings?
16th, that's or my, I don't
Yeah.
know.
16th works.
16th works for me.
Honestly, I gotta look at the grant. I think it's.
Thank you, guys. Appreciate it.
October
Get that
16th,
efficient.
shoot for that day, and then we'll figure out, once we kind of know the agenda, figure out if we need full day, half day, kind of what we need from a scheduling standpoint.
Yeah.
Any other business?
What day do you gonna land on?
October 16th?
Okay, wear your Halloween costumes.
No. That meeting lasts until the 16th.
Oh, wow.
Sorry.
That's a long one.
It is.
All right, then.
But it's, I mean, and again, you don't have to have us.
Well, you were very helpful today, so
Yeah.
you should.
That's the thing.
And that's been why we're getting Candace bolstered. She's eventually picking all this stuff up, so.
I just don't want it to be your second
you go.
meeting. You're on your own.
Move up September 18th.
And we don't run the
Sure.
loaner all.
Yeah, September 18th is
work for
fine.
you?
September,
That's where we are.
we shifted.
Well,
We jumped a month.
it's either that or we go the 23rd of October. I just
Okay,
didn't know how far we
September-
want to go out.
18th through 3.
September 18, I'm good.
All right.
Bingo.
Let's
18th
do
or
it.
16th? Sorry, I don't know what I
The
said.
18th is a
18th,
Wednesday.
a Wednesday.
September
Oh,
18th
Yeah.
is a Wednesday.
helps if I look at the right calendar.
We went back to September 18 VMAC.
Wait for him,
I'll be here.
Just tell me, when to be in this room.
Okay, September
Martin
18th.
doesn't send me on drills.
Perfect.
Is there a motion to adjourn?
So moved.
Second?
Yep.
Second.
Any discussion? All those in favor, aye?
Aye.
Yeah. Oh, yeah.
So was there emails, man?
No, there was supposed to be.
Recording stopped.